Thank you. Welcome, committee members, presenters and observers. Welcome to this meeting of the Health and Adult Social Care Select Committee. This meeting is being held remotely and members are in attendance via video conferencing. The meeting is being live streamed and will also be available for repeated viewing. During the meeting, if a member wishes to speak, they will indicate as requested and I will call them to speak in turn. I'll begin by reading the names of members on the committee so they can confirm their attendance for the public record. So I'm Councillor Roger Huxtep as Chairman. Councillor David Keast is Vice Chairman. David?
I can confirm that I'm in attendance. I've read the papers and I have no interest to declare.
Thank you, David. At this stage, we're just checking names and attendance. Councillor Martin Boyles.
Attending here.
Councillor Anne Briggs.
Good morning, Chairman. I'm present.
Councillor Adam Carew. Councillor Frank Carpenter.
Present, Chairman.
Councillor Tonya Craig.
Present. Good morning, Chair.
Councillor Rod Cooper.
Yes, good morning, Chair. I'm present.
Councillor Alan Dowden.
Present, Chairman. Good morning.
Councillor Jane Frankham.
Good morning and present.
Councillor David Harrison.
Oh, Chairman, I'll offer his apologies. He sent me an email. He's unable to attend. It clashes with another meeting, which is very important.
Okay, thank you, Councillor Dowden. Councillor Hare.
Good morning, Chairman. Present.
Councillor Neville Penman.
Good morning.
Councillor Mike Thornton.
Yes, good morning, Chair. I'm present.
Councillor Ridian Vaughan.
Present, Chairman. Happy St David's Day.
And to you.
Thank you.
Councillor Michael White.
Present, Chairman.
Councillor Diane Andrews.
Present, Chairman.
Councillor Julie Buckler.
Present, Chairman.
Councillor Jonathan Canty.
Good morning, Chair. Present.
And Councillor Cynthia Garton.
Yes, good morning, Chair. I'm here. Thank you.
Thank you, everyone. Right, for clarity during the meeting, if the outcome of an item is to note the update, I'll ask the members to unmute and confirm verbally if they are happy to agree that outcome. If there is any dissent or request for recommendations, members, please use the raise hand function and I'll call you to speak. For any recommendations to executive members or an electronic poll will be conducted that will display to committee members. Members, please indicate your vote by using the appropriate button and hitting submit. Democratic Services Officer will confirm the outcome of the poll for the record. I'd like to remind members that the Constitution standing orders will apply, so please keep your microphone muted unless you have been called to speak, and that you may be visible on the screen to the public and to other members, even when you're not speaking. So, Marie, apologies for absence.
As has already been said, we've had apologies from Councillor David Harrison and we have Councillor Dominic Hiscock in place as his substitute.
Thank you. Thank you. And I also noted, Councillor Hiscock, that you may have to leave around about 11:30, so that's fine.
Yes, I'm afraid so. Thank you very much, Chairman.
And Councillor Canty, I understand you also need to leave at noon for an hour or so.
That meeting has now been cancelled, so I think I should be able to remain in the meeting.
Oh, excellent. Thank you.
Sorry, Chairman, I'll have to leave early as well. I'm sorry about that.
Who was that?
Councillor Penman.
Ah, got you. Yes. Okay, Neville. Thank you. Right. Declarations of interest, item 2. All members who believe they have a disclosable pecuniary interest in any matter to be considered at the meeting must declare that interest. Furthermore, all members with a non-pecuniary personal interest in a matter being considered at the meeting should consider whether such an interest should be declared. Are there any declarations of interest, members?
No.
No declarations. Thank you. Item 3, minutes. To confirm the minutes of our meeting of the 11th of January 2021. Are they agreed?
Agreed.
Thank you. Item 4 is deputations. I am not aware of any deputations. Can you confirm that, please, Marie?
That's correct. We've not received any requests to speak at this meeting.
Thank you. Right. I've got 2 announcements. The first one is the second meeting of the Joint Scrutiny Committee looking at the Hampshire Together proposals has been scheduled for next Monday, 8th of March. The committee will be considering further details of the options that are due to be put forward for public consultation at the end of May. And second announcement is really just, I've intimated this earlier this morning. The last meeting was long and we have a similarly full agenda today. So your support with getting through items concisely would be appreciated. I intend to take a short break around midday and then press on with the remainder of the agenda to aim to finish the meeting by 2 p.m. or earlier. So now we can go on to item 6, which is issues relating to the planning, provision and or operation of health services. This item is covered in pages 11 to 36 in your packs. So the first is to consider a report of the Director of Transformation and Governance on issues brought to the attention of the committee which impact upon the planning, provision and or operation of health services within Hampshire or the Hampshire population. And the first item relates to NHS OneonOne performance. And members will recall that this member was deferred from the January meeting. And the slides for this presentation are in your agenda pack starting at page 17. The presenter is Mark Rowell. He's Head of Integrated Urgent Care and NHS OneonOne Services, South Central Ambulance Service, NHS Trust Foundation. At this point, Mark, I'd like to apologise for us not being able to accommodate your presentation in the time you were able to give us last time. That's why you're ahead of the queue this morning, so welcome. Do please present.
Okay, yeah, thank you for that, and that's fine. Okay, Chairman, I will share my slides. Can everybody see that?
Yes, I can see that.
Brilliant.
And it is also on our iPads.
Okay, cool. Okay. So thank you for inviting me to present for you today. So what I thought we'd do, certainly for the OneonOne service, is really just to provide an overview and a context as to where we've been over the last 12 months, because it is fair to say it has been fairly challenging, like other NHS services. We've been part of been affected by the overall pandemic response. So on the slides here, so SCAS actually has been a major part of the COVID-19 response, certainly from a national level. We were awarded the contract for that. So we were mobilised as part of the pandemic response. And as part of that, certainly the local OneonOne service was asked to do a number of things. And one of those was to help the national team set up the National Clinical Assessment Service. And as part of that, we obviously had to put in a technical solution for that, put in the telephony solution for that. And has also set up a number of specialties. So that was the GPs, so those GPs that came out of retirement to form part of the National CAS service, and obviously the employment of some pharmacists and dentists as well. So the beginning of last year, we set up that national service. Now, in order to doing that, that took some of my resource, if you like, OneonOne management resource out of the main OneonOne service and some of the call handlers and service advisors we have. So that immediately put some pressure on the OneonOne service overall, but we were able to backfill to that as well. One of the other things set up as part of the national response was the COVID response service, so CRS, and that was put in place so anybody had concerns related to COVID-19 were answered by a different cohort of call handlers. And again, we were asked to support that as a local NHS 111 service. And in order to do that, what we set up was any patient phoning that COVID response service, if there were still major clinical concerns around that patient, then those calls were diverted to the local NHS 111 service, which was SCAS. And we supported that as a clinical safety netting service. So the patient got a further clinical triage using the Pathways, which is our clinical triage tool. And we were able to obviously support that service. While doing that, most of the local NHS 111 calls went into the national 111 service. So, still answered in the same way, still using NHS Pathways and using the DOS to signpost those patients appropriately. So the service didn't change, they were just answered by the national 111 service rather than the local 111 service. And we supported the safety netting service certainly from March, 9th of March till roughly the 9th of June. So that was quite a significant time, really. That demand was quite significant and certainly above our contracted levels we would experience anyway. And we were also involved in the early doors, some of the track and trace that was put in the early part of the pandemic, and also signposting patients to the hot hubs. So certainly for the first 6 months of last year, we were under significant pressure to manage new services as well as trying to support our local services as well. So that's roughly where we are in context for the 111 service locally and supporting the national team. So our performance then. So since July, we've been back operating July last year, we have been operating as a normal 111 service. And what we did see was our demand profile change quite significantly from out of hours to in hours, again, mainly due to local lockdowns, people working from home, and obviously closures of other services as well. So what we saw was people phoning during the day rather than and obviously a typical 111 service being an out of hours profile. So that and we saw around 30% increase in our demand, which was quite significant. And that's where our performance challenges were. They were mainly during the day. And clearly what we needed to do was either move staff around to meet that profile or recruit more staff. Some of those increases clearly were caused by the pandemic. Also, we saw further demand when schools returned back to school, certainly in September. Again, we saw that step change again because people were obviously concerned, needed to have questions answered around the pandemic and the COVID-19 responses. So we saw a lot of demand come from the schools. Changes in government policy, every time they changed a process or changed guidance, again, we saw these peaks coming into 111. And equally, primary care were under pressure as well. So in staff, patients not being able to go into primary care, then they just phoned 111 as well, which is fine. And also there were lots of services, so dental services, again, people having access to dental services was quite challenging, trying to get through. So we saw an increase in our dental demand as well as then dealing over that year with a number of changes to our clinical system and operational platforms to meet the response to the COVID-19. So clearly all of those elements had a massive impact on our performance overall. And again, that was felt nationally as well. So clearly we had to respond to that and do some recruitment. So we have been recruiting throughout the 12 months, quite a large recruitment programme. So we did have a recruitment plan in place. Certainly over the summer, we were able to recruit a significant amount of staff. Most of those are either on furlough, obviously lost their jobs, were looking for jobs. So we certainly had a plethora of people that were wanting jobs. So we were able to bring these people in. And we certainly recruited around 40 staff, certainly during the summer period, to help with our in-hours demand. And that's where those call handlers worked. To bring them in quickly, we shortened the course. They were only dealing with specific calls, which again was helping the overall demand. Long term, we needed to review our demand, what we were seeing in hours as well as out of hours, and obviously we remodeled and included the demand we were experiencing. And as you're all aware, we were obviously being asked then to put in Think 111 first, and that was putting direct booking solutions into ED departments and asking patients to phone 111. And what we saw, the additional demand to that was roughly around 20%. So we put that on top. What that gave us was 70 whole-time equivalents, so from a financial point of view. But in real terms, the way 111 works is that actually we need 2 heads for 1 financial WTE, because that then meets the contract. So we're doubling our resource effectively. So actually that's a big ask from September to now to actually employ 120 people. So that's quite massive, quite significant, given the training course is 6 weeks, you know, and it's 6 weeks out, and then really they don't become work effective till probably another couple of months later. So it's quite a significant challenge to recruit all of these people. And say we've been doing that since September. In order to meet that demand for the training, we obviously doubled our training across our 3 locations. So we've got a call centre in Milton Keynes, we've got one in Bicester and one in Hampshire, down there in Otterbourne. And so this was the plan that we put in place basically for our recruitment, for our non-clinical staff. I'm happy to say now that we have reached that plan. So we were significantly under, as you can see, but we are now, certainly by March, we are now fully established, if not over. And I am happy to report that performance is improving significantly, and we are starting to meet our contractual requirements from a call answering perspective as well. So clearly we still had those performance challenges throughout the winter and Christmas period, again mainly due to the second wave that everybody is aware of, and obviously some of our challenges with our staff as well, because clearly they were affected by COVID related incidences. So they were isolating, certainly shielding. So our pressures were equally with our staff coming to work as well, like any other provider, really. So we had to manage that as well. We had a particular outbreak in our Northern House location, where at times then we had to go to national contingency support to try and maintain our performance and support our overall performance. So again, quite challenging for the staff and quite unnerving for our staff as well to be in that environment. So we did put a recovery plan in place due to all of the issues I've outlined, and some of that is looking at our call centre metrics as a call answering service. It is around the call length and the not ready of our staff. So we've put all of those things in place and all of the support for our staff to meet that. And as I've said, you know, certainly in October to December, we were able to bring in 101 staff as part of our overall plan, which is massive, absolutely massive, quite significant on the service. This slide here really just gives you that overall demand shift we were seeing. So the yellow line across the top is what we were being offered during the in-hours period, Monday to Friday. And you can see that second line, which in general, which was what we've been modelled for. So a significant gap there that we needed to address. And that bottom line was that performance. And you can see when those lines meet, our performance is good, but those demand pressures in hours were quite significant. And hopefully we've addressed that now. Our demand in hours is still quite high, but in essence, we've now got appropriate staff within the in-hours period and the out-of-hours period, and we've reprofiled. And that's why we're now starting to see that performance improve. This slide sort of picks up on some of the COVID-related symptom groups we were getting. Certainly, you can certainly see that peak in December, and it is starting to tail off. Those lines at the bottom are actually where are the coughs, colds, and the flus and the fevers that we would get normally in a winter profile. And actually what you would see in certainly November, December time is those ones increase. Similar profile to what you can see, the blue line there with the COVID-19 symptoms. But what we have seen this year is clearly those symptoms flatten out, and obviously COVID related come to the fore in essence. And again, I think some of that, the sore throats, cough, colds and flus, very much around self-isolating and the wearing of masks. So some of the national guidance that was put in place, we feel had an impact on that. So that's been quite interesting. Some of our outputs then certainly from a 111 service nationally. So we're measured on our 999 outputs from 111, sending cases to 999. And as you can see, we've had some significant pressure, certainly December, January. But in general, the local service is around 2% lower from the national average from a 999 perspective, which is really, really positive. And we've been managed to achieve that. And similar with our ED. So again, our outcomes, we are measured on that. And since the inception of Think 111 First, and obviously that booking into ED, what you can see here is a significant drop in our ED presentation from 111 into ED. And that's driven by our clinicians, all of those calls going to our clinicians, revalidating those calls, and if appropriate, signposting those patients elsewhere, and if appropriate, then sending those patients to ED, but with a booked appointment. So those patients are heralded appropriately. So that's been really quite significant. Just trying to understand why we suddenly got that uplift again in ED heading towards February. But I'm still looking at that just to understand why that's happened. But we were making really, really good progress locally from that national initiative. And again, these are just some of the outputs from the CAS provider. So it's that local clinical assessment service that within the Ports of the South East area are managing, revalidating those patients from 111 with either an ED or a Cat 3-4 outcome. So there are 4 grades of ambulance, Cat 1 and 2. They're life-threatening and urgent in general terms and go across to 999 for them to dispatch, but actually Cat 3-4, which is one of the ones we revalidate. And actually you can see here some really, certainly ED type 1 and 2, gone from 5% to 1% to January, which is really, really positive outcomes for the patients and then being signposted appropriately. And some of that signposting is primary care, either into their GP or other local services. So really, really quite positive with our outcomes. And now I'm happy to report that certainly our call answer percentage for answering the calls, and as I say, has significantly improved, certainly over the last month or so. And that's it from me.
Thank you, Mark. That was very useful. I'm glad you were able to make your presentation this time. I've got 2 questioners on my list. The first is Councillor Canty.
Good morning, Mark, and thank you for your presentation. I just wanted to ask about the impact of the vaccination programme and whether that's led to any additional demand in your services. My understanding is that NHS 111 is being used as part of the national booking programme, so I'd be interested to know whether that is leading to any additional demand. And secondly, you mentioned the pressure on the North 111 service before Christmas, and it'd be useful to know whether there's been any particular districts in Hampshire that have seen a higher level of demand than others during the pandemic period.
So to your first question, so 111 South Central Ambulance Service is involved in the national flu pandemic line and the vaccination rollout, but there is a separate call centre for that and a separate number. So that's not overly impacted on 111 overall. Certainly the North call centre, clearly was most of that we had a high high population area that was affected in Milton Keynes, and some of our staff were working in Milton Keynes who worked in Bicester. So that was, affected overall. So it was North and possibly the Slough area that we saw the biggest. So Milton Keynes and Slough were the biggest areas that we saw with outbreaks, if you like, of COVID as high areas. And we were getting significant calls from those areas equally.
Is that okay, Councillor County?
There was just one additional thought I had, which was any particular districts in Hampshire where you've seen additional levels of demand during the pandemic?
Not overly. It's not overly. It's sometimes very difficult to break it down via the telephony route. It is difficult to pick up those areas, but there was nothing that stood out overall.
Okay, thank you. Councillor Dowden was next, actually, and then I've got Councillor Briggs, Councillor Hare and Councillor Thornton. So, Councillor Dowden.
Yes, thank you, Chairman. It was mentioned during the presentation that, of course, for additional staff, they took on furlough people, and their training was speeded up, if you like. Can I ask, how did you deal, because there'd been a great increase in mental health issues, not only nationally, but I'm sure locally as well in the area that you cover. And of course, how did you deal, because it has to be dealt with very sensitively, any mental health issue? How did you deal with those?
Yes, so we have the mental health service within Hampshire is actually within our CAS services, so it's in the local clinical assessment service. So we absolutely have our mental health service within the 111 service itself. So any patient who phoned with a mental health presentation, those calls would have been transferred into the mental health services directly for them to phone those patients back. So those patients got quite a speedy response, actually. So we managed that quite effectively.
Okay, well, I'm pleased to hear that. And the second question, if I may ask, is that obviously during the lockdown, there was a lot more, during the COVID period, a lot more of home working. How did your staff and everything cope with home working?
So I've been home working since last year, so I've coped with it very well. Some of our clinicians also worked from home and routinely do work from home. So we were able to expand that expansion around our clinicians home working, because that works really well for them. So we were reasonably well set up for that. We did look at obviously trying to see if our call handlers could work from home, but it is quite a part of the license agreement with NHS Pathways is that those call handlers must have access to a clinician to support them when their calls get complex. So that was quite difficult to do. But where we could, we made our staff work from home. And say we already had that in train, so we were able to expand that, certainly for our clinicians.
Thank you very much.
Thank you, Mark. Just for the public record, Councillor Carew has been able to join the meeting. The next question comes from Councillor Briggs.
Thank you, Chairman. And thank you for the presentation. I can certainly see why you can have problems with staff, because everybody has to ring 111 now for any problem. So it's a quick question, please. How you say the call service, the waiting time is decreasing. So how long is the actual waiting time now, please?
Sorry, that was very broken. Can you say that again? Sorry.
Okay. What is the average waiting time for people who are ringing you?
So in average, when we are significantly under pressure, I would argue some of the waiting time is on average around 2 to 3 minutes. But when we're hitting performance, in essence, we are answering the phone within 10 seconds.
Well, that's a considerable improvement. Thank you very much.
Thank you, Mark. Next question is from Councillor Hare.
Thank you, Chair. Mark, I just wanted to ask, in terms of COVID, I know it's put lots of pressure on the 111 system. Has the 119 number reduced any pressure? Is it all interlinked?
So 999 do again have seen that pressure overall, certainly in the beginning, but there are times, certainly over the last several months, they've seen a drop in their demand with patients staying at home and stuff like that, so that they see more of a drop in their demand overall.
Yeah. Sorry, was that was 119? Yeah.
Yes.
Okay. Thank you. Thanks.
Thank you, Mark. I've just got a couple of questions of clarification, if I may. On page 24, you're showing the COVID-19 symptoms and the decline, but that chart ended about a month ago. I presume that decline has continued, and the lower level lines are still more or less flatlining. Is that true?
Yes, that's correct. Yes.
Good. And looking at the chart on page 27, which is PSEH system, are they stats relating to Portsmouth and Southampton? I couldn't find a decode for PSEH.
Sorry, so that was Portsmouth, South East Hampshire. So that is Portsmouth, South East Hampshire, Fareham and Gosford. Sorry.
Yeah. Okay. And those stats, is it true to say, therefore, that only 20% of the calls on average relate to 999 or ED types 1 and 2?
So in essence, yes. So across on average we're around 10-11% 999 as an overall for the local Hampshire and Surrey Heath providers. We're probably achieving around 11% for 999, and that breaks down roughly half and half for type 1 and 2, which is obviously the acute side of the 999 presentation, and roughly around, again, another 5-6% Cat 3-4. And the Cat 3-4, from a national point of view, they go into a triage pot, so they go into our clinicians to revalidate those patients. And we see quite a significant, around 50 to 60%, depending on what the day, of those calls being downgraded from a Cat 3-4 and either then sent to ED or into primary care. So it's quite significant.
Yes, I mean, it shows that about, 4 in 5 calls are not actually resulting in real medical emergencies, which is actually good, but it's also bad in terms of clogging up your service.
No, absolutely. And what we're able to do is feedback. So all of our, if you like, triage endpoints and all of that data does feed up nationally. And so they're able to review those outcomes and the symptom groups and make some relevant changes then to the overall clinical triage systems we use. So we are constantly feeding some of this back.
Thank you. No further questions. Does anyone have any debate or comment to make before we go to the recommendations? No. So we are noting the report given by Mark this morning. Are we happy to do that?
Yes.
That looks like general assent. Thank you. And we should consider whether we need an update report. Now, it seems to me, Mark, that you're very much on top of this system. It's still not easy, but you're not under huge pressures. So would it be appropriate for you to just send in a written report whilst the COVID combat is still continuing?
Yes, I'm happy to do that.
You're happy to do that. Are members happy with that as a response from Mark Roll this morning? Yes, that's good. Well, thank you, Mark. Thank you for making it this time, and we look forward to hearing good reports later on in the year as hopefully COVID-19 subsides. Thank you very much indeed.
Okay, thank you.
Right, the next item under 6 is the CCG Merger update. The update is included in agenda pack starting at page 29, and a more up-to-date version of the executive team chart added as a supplementary document. A marvellous array of colour photographs of personalities in the system. So today we have Maggie McIsaac as Chief Executive of the CCG Partnership here to present. So welcome, Maggie. Are you there?
I am. Good morning.
Good morning. Please go ahead.
Okay, well, good morning, and very pleased to just bring you up to speed with our progress on our CCG merger. The paper, I hope, is self-explanatory, so I wasn't going to present any slides or indeed sorry. There we go, that's all right. Yes, no, so I wasn't going to present any slides, but rather just draw your attention to the key points and then obviously any questions. So we've been working on our merger as planned. We came to you before with this. We've had to be proportionate about the resource we put into the merger process during COVID, and colleagues will be talking to you about COVID and the response, and particularly this morning we're very pleased actually to be sharing with you the vaccine progress, which is of course one of the very critical ways through COVID. So all the way along we made sure that we kept in check time and resource spent on the CCG merger versus the response, and we're pleased that we've been able to do that. So the detail is in the paper. This is the Hampshire, Southampton and Isle of Wight CCG, everything going on track for the 1st of April. Later this week or the beginning of next week, we will be able to write out with all the board appointments, the non-exec lay appointments, which are active as we speak. We're nearly concluding those, and then we'll be ready to go from the 1st of April. Couple of things I wanted to remind you of and reassure you of. First of all, Portsmouth CCG is staying as a statutory body from April, but the two CCGs will be working really closely so that commissioning decisions across the piece are done very easily and sensibly without overlap or duplication. So a huge amount of detailed work between Portsmouth and us, and we can certainly share more of that again in the next few weeks as the details are finalised. The second thing I wanted to remind you of, and to make sure everybody's really focused on this, that although we're bringing the CCGs together, which really helps with doing things at scale, with the same focus, we're also getting more local, and more local actually than the constituent CCGs, because we know, don't we, our COVID response has just been amazing in local communities with local people and all our organisations. So if you like, this is a change where we're coming together and getting bigger to take those benefits of scale, and within the new organisation we will be empowering and delegating to local so that we really continue the strength of local work. So that's really important to hang on to. The final thing I just wanted to say was that obviously very recently the white paper came out, and that affords more options and opportunities. We'll see where we go with that. and probably as we get to your next meeting, all of us might be in a place to know how that is going. But we believe strongly that if the propositions in the white paper are approved, then the bringing together of the CCGs would be a very positive transitional step to the proposition for the changes in the white paper from April 22. So we are confident that we're good to go for April, good to make the transition, and that it puts us in a good place together with Portsmouth moving towards what might be a slightly different statutory framework from April 22. So what you can expect from us, as I say, by the end of this week, early next week, is a full briefing on all the people who've been appointed to the board, and particularly so the chair and the non-exec and lay members, which we'll be able to announce very shortly. So I think I'll stop there, none the least because I know Jenny Irwin, who's joined us on vaccines, has got a very tight window, and I desperately want you to be able to have the news on vaccines, which is obviously so critical at the moment, and actually is a good news story. But I'll stop there.
Thank you, Maggie. That's very useful. I've got a question from Councillor Dowden.
Yes, thank you, Chairman. Yes, Chairman. I have grave concerns over this, and also a lot of local people have grave concerns. I know the Romsey Local Health Forum that I attended, the GP was there who was very concerned, and a lot of the other health organisations that sit round the table were concerned about it. Now, the West Hampshire, under Sarah Schofield, who was the chairman, has worked very well, and there's no doubt about it. People are generally happy with what's gone on. The trouble is, this seems to me moving the deck chairs around. I'm sorry to say this, Maggie, but of course, at one time we had a health authority, and it appears almost like a mini health authority, if you like, going back to just the one for the whole of Hampshire. Whereas years ago, I was a member of the Western Test Primary Care Group, and there were quite a large number of other primary care groups. And every time there was a change, it cost money, because of course chief executives were made redundant and various people, and it always seems to me there's a change of deck chairs and there's a lot of money taken out of the system, and because you know certain individuals get a payoff. Now I can't really see the benefit of this, quite frankly. Maybe I'm on my own, I don't know. But I'm certainly not on my own in regards of in the area that I represent and in the whole of the Romsey area. There was grave concerns expressed about it. But it's ploughing ahead, and I'm no doubt nobody where to stop it anyway. But I have to express my concerns about it. To me, it's just moving deck chairs about, and I'm not really sure there will be great benefits. Yes, it's been true that the NHS has done a wonderful job, and also the local GPs in getting out the vaccine to people. No doubt about that. It's been a wonderful job carried out by the NHS generally. But I can't see, you haven't convinced me that this will be of great benefit to the overall Hampshire residents than what we've presently got. Perhaps you could answer some of those.
Okay, well, no, thank you for those comments, and I know you said that to us before, so I'm sorry that we haven't managed to convince you, and maybe we should have a conversation offline as well. So a couple of things to say. Actually, the vaccine programme, rather interestingly, I think supports what I'm saying about working at scale and working locally. There is no doubt we would not be so far ahead as we are in Hampshire and Isle of Wight if we hadn't had the two things working in tandem. So Jenny Owen and Nigel Watson running the programme across the piece, and then our local primary care networks together with Solent, who've helped superbly with this, running things locally. And I think we need to do both. And I think there were real disadvantages of having multiple smaller CCGs for the things that needed to be done at scale, none the least, you know, multiple boards and governance arrangements. So what we hope to do is to make sure that we keep the benefits of local and further accelerate that. We take the gains of scale, and that we don't rearrange the deck chairs, that this is culturally different, keeping the things that were good and actually putting right some of the things that weren't always great about CCGs and some of the issues that we picked up in the Langsley reforms. So there will be some changes ahead that we think will make a difference, and clearly that's for us to prove that to you. But I hear the concerns, and thank you for sharing that. We've worked really closely with all our GPs. Change is difficult. We're not getting rid of a lot of chief executives. I'm already the chief executive of all the CCGs that we're talking about. We have been working in this way for the last year or 18 months. What we're doing though now is actually merging the organisations rather than, you know, sharing a management team. So thank you for your comments, and we take them very seriously, and our job is to show you that we mean to make this better and not be, I think, your fear. So thank you for that.
Okay, Maggie, if I could just come back, Chairman.
Councillor Dowden, sorry, I'm going to interrupt proceedings.
Oh, sorry.
I've been informed that Jenny Owen has to leave at 11. And she is presenting in item 8.
Okay.
So with members' permission, I'd like to jump to item 8 and allow Jenny Owen to speak, and then we'll come back to the rest of the questions for item 7. And we'll start with you again, Councillor Dowden.
Okay, thank you, Chairman.
Jenny Owen, are you able to present now?
I am. Thank you very much, Chairman, and apologies for having to juggle the agenda around somewhat. It's a bit of a stretch to try to get into all the places that I need to be at the same time in terms of the oversight of the programme. One of the things I did just want to say is from a whole system programme point of view, I'd absolutely echo what Maggie has said. Being able to run the programme across the whole of Hampshire and the Isle of Wight in jointly has led us to be quite far ahead in the programme. All of our primary care teams have had great support from a single centralised team that has really been able to work jointly with regional colleagues and make sure that the programme across the whole of Hampshire and Isle of Wight has been really strong. Our delivery to date has been fantastic. We have across the first 4 JCPI cohorts, which you'll remember is essentially anybody over the age of 70 and anybody that's at extreme clinical risk. We're now at 93% of all of those people. There are only 16,000 people left in Hampshire and the Isle of Wight who have yet to be vaccinated from those groups. And I'll talk a little bit in a minute about our focus on those individuals and how we aim to continue to make sure that we meet all of those needs across the patch. So when the current focus of the programme is cohorts 5 and 6. So cohort 5 is those people over the age of 65, and cohort 6 is anybody over the age of 16 who has a long-term condition. So broadly speaking, our primary care colleagues in the primary care networks and GP practices are calling up their patients who are in that group and working closely on cohort 6. The reason they're focusing in that area is, of course, because our GP colleagues absolutely know who they have on their registers who have a long-term condition, and they would want to be bringing those into the clinics they've set up already to make sure that they have those vaccines close to home within their local communities. Our vaccination centres are utilised by people who receive a letter from the national booking system. So when a person receives a letter from the national booking system, their main choice to book in is through any of our places that are live on the national booking system, which is our vaccination centres and our community pharmacy locations. Just as a reminder, we've got 4 vaccination centres which are sort of broadly placed across Hampshire and the Isle of Wight. So one on the island, one over in Portsmouth at St James's Hospital, one at Oakley Road in Southampton, one up in Basingstoke. We did that to make sure that we had a broad spread across the population, and that's now supplemented by many local community pharmacy solutions, and we're in the process of reviewing the need to include additional local pharmacies to make sure that any pockets of communities who don't have access that they would like to have are able to be seen in their local places. Just in terms of the work that we've been doing on inequalities, I'll just do a minute or so on that one, then leave some space for people to ask questions. But within cohort 6, there are a number of certain groups that we want to make sure that we reach very proactively. Learning disabilities, fantastically, we now have such a broad definition that's been added by the JCPI committee and by central government. So we have a very targeted approach for people with learning disabilities. We've undertaken a process of stratifying the risk relating to people with learning disabilities, i.e. those who are most at risk in their supported accommodation, whatever form that takes. We have a clear plan for every primary care network to visit all of those patients in every location that they are and vaccinate them and their carers or people that support them to look after them. Those people who are living at home with intensive support, again, we have the home visiting service through the primary care networks, which will be visiting all of those people. And then people who are able to or want to come from their home addresses to be vaccinated, we are enabling all of those individuals to come forward. And for our vaccination centres, our learning disabilities teams, working really closely with Hampshire County Council, are visiting all of the vaccination centres, ensuring that they're learning disability friendly environments, advising the staff there on how best to look after those people when they do come. And in fact, this week we have some learning disability friendly specific clinics happening across the patch, which means that people will have slightly more time, they can bring their carers with them for single appointments, and that those interventions should be slightly quieter and less frenetic for people to come in. We're also using it as an opportunity to target people with learning disabilities for a conversation around their generalised health checks, so that potentially when people come back for their second vaccination, we can do a little bit more around people's general health and well-being and make sure they're very well connected to their primary care services around long-term health. And the same is true for mental health as well. For people living with mental health issues, we've got a very targeted approach to outreach to people in communities. Solent Mind have been doing a fantastic job for us of connecting with all of the people that are on their radar, having direct conversations with them to make sure that they understand the letter that they've got, that they can discuss any concerns they've got around vaccination hesitancy, and that they're supported to come and have their vaccine, and with everything they might need, whether it's somebody to come and pick them up and take them with them in a befriending sense, whether it's formal transport, or whether they genuinely need somebody to come and visit them at home. So we're working through all of those processes at the moment. In addition to that, our Inequalities Committee is meeting weekly and feeding into our strategy group, which outlines the solutions that we'll build in for any other groups, whether they be Black and ethnic minority communities or rural communities or any other community which may need a specific bespoke approach. And all of those solutions are being worked up at the moment. And so we hope to have completed those groups within the next 2 or 3 weeks as well. We've done some fantastic work in the Portsmouth patch around reaching out to the homeless communities, and we're aiming to replicate that across the whole of Hampshire and the Isle of Wight to make sure that those communities are not left behind either. And our focus going forward is now to work with the JCPI committee, our regional and national colleagues, and make sure that we target next people over the age of 50 as we move down through the JCPI cohorts and then into the general well population, which is essentially anybody between the age of 18 and 49 who's generally well. And that will be the next approach. And we await detailed guidance from central government, but you will have seen in the press the JCPI's interim statement, which essentially says we'd be looking at those in sort of chunks of 10-year groups coming forward to attend the programme. So I think if I leave it there, it gives us a few minutes for any questions, things people want to ask. Thank you very much.
Thank you, Jenny. That's a very comprehensive update, and appreciate the time pressures. I've got Councillor Buckler with a question.
Oh, thank you, Chairman. Yes, actually, I've got a question for item 7, but actually while I'm here, you talk about, I think it's...
Sorry, I'm going to interrupt you now. can
no,
you
I'm going
put
to talk
your...
about item 8, actually. I've got a question for item 8 as well. So if I may, I can do
Yes.
that and then keep my
Just
hands for item 7.
Yeah, half a minute, Julie.
Okay.
If you've got your hand up, but it's for agenda item 7, can you take it down, please? I only want to see hands for item 8 at the moment. Questions to Jenny Owen. So, Julie, carry on, please.
Thank you, thank you. It's really good news, the vaccinations. I have to say congratulations to everybody. I think it's absolutely brilliant to see how it's going through. You talk about looking at new venues to be able to vaccinate more locally. My inbox has been inundated with queries from the residents in Alton. Are there any plans at all for Alton, but particularly in some of the other outlying towns? That would be really great if I could feed any of that back to them. It would save my inbox considerably. Thank you.
Yes, absolutely. Thank you. Alton is a particular area that Maggie and myself have been focusing on in great detail over the last 2 or 3 weeks. I think it's always very difficult to add extra locations because they need to be added to national systems and then have their own supply of vaccine coming down the line, etc. So we have to be very clear that we definitely do need an additional venue or an additional space. But Alton is a particular area that we've been focusing on in great detail. We do have a number of pharmacies that are open to providing in Alton, and we want to make sure that the solution we put into Alton is absolutely sustainable. So it needs to be part of the fabric of Alton and not just a kind of pop-up clinic that comes and goes. So that's why we want to be really clear that we want to add something that is at the centre and is absolutely permanent for the future. So we aim to have a finalised solution by the end of this week, early next week, that we can share with you, which details which location that would be in. But we're absolutely committed to having something in Alton for the people of Alton. And just to give you some reassurance that so far we've not had any discrepancies between people taking the vaccine in Alton and anywhere else. And in fact, Alton residents are further ahead than some of our other patches. So we're very assured that people who from the high risk groups who've needed the vaccine have had it so far and have had the opportunity to have it. But we recognise that as we grow out into the wider cohorts of people, etc., we absolutely do need to find something specifically for Alton, and we're very focused on that.
Thank you, Jenny. Next question is from Councillor Fran Carpenter.
Thank you. I just wanted to say, Jenny, thank you very much for filling us in. It's very good to hear about the comprehensive service for people with learning disabilities and their carers, as they have special concerns, I know, and they've been ongoing for a little while. And it has been a worry for them, so that's great. Are you aware that other areas, I know you're West Hampshire, other areas are as on the ball as you are?
So just to be clear, I'm working as the SRO for the whole of Hampshire and the Isle of Wight, and this absolutely all of our local authorities are working together jointly with us to do that. So yes, I work historically for West Hampshire CCG, but absolutely we're working as an entirety across Hampshire and the Isle of Wight, which is one of the beauties of working together across the whole patch, is that all those areas get the same level of focus.
Thank you very much. Okay.
Next question comes from Councillor Palhare.
Thank you, Chair. Jenny, mine is not really a question, it's just a comment, really. Thank you very much for giving us all the information, and it's been a fantastic programme. I just want to highlight how the importance of volunteers. I've not heard a bad word about anything. The whole programme has been going very, very well, especially in our little patch, and I'm sure it's everywhere else too. So can we sort of highlight a little bit more about volunteers, because without the volunteers it wouldn't be as successful as it has been. So if you could include that wherever you advertise or you know, in your works. Thank you.
Sure, thank you, Councillor. It's a very important point, actually. We've had fantastic support from every level of volunteers, actually, whether it's members of the public through to other agencies and partners across Hampshire and Isle of Wight that support us. I'd be very happy to bring back something in a bit more detail next time so people can see with a bit more depth what's been happening in that respect.
Thank you for raising that, Councillor Hab. We'll make sure that it's covered in the minutes. Question from Councillor Carew.
Thank you, Chairman. Could I ask, you mentioned about the rollout of the vaccine, which is very, very welcome. However, could you give us some rough idea about how long that's going to take, particularly with regard to people on your list who are, shall we say, are having to safeguard because they are not particularly well or have ongoing medical conditions. I'm particularly interested within East Hampshire. I know we've got the three main ones at Portsmouth, Southampton and Basingstoke, but I know the others are being rolled out through surgeries, and my understanding was the surgeries only put them on when they actually get told there's enough vaccine.
So the vaccine supply does fluctuate, and the last 2 or 3 weeks has been a tighter 2 or 3 weeks than other components of the programme. So it's a little bit supply capacity and demand dependent. So we do a bit of a weekly juggle. And what I would say is that anybody that you've just spoken about would either be in cohort 4, which is the extremely clinically vulnerable individuals who are shielding on the shielding list, which is separate to anybody with a long-term condition because they're sort of more broadly unwell but weller, as it were, in terms of clinical risk. But our aim to finish cohort 6 by the end of March. So that would mean that everybody you're talking about should have been offered a vaccine by the end of March at the very latest, whether they're extremely clinically vulnerable and shielding or just generally have a long-term condition and live in the community. Absolutely. But we do expect supply and demand to ramp up in the next couple of weeks, and we'll be adjusting the programme capacity and putting on many more clinics and sessions aligned with that supply as they come. But certainly our primary care teams are ready to flex and focus, and they can put on more or less clinics as we go. We flex each week.
Thank you, that's most helpful. Yes, it was the category 4 people I was thinking of. Thank you.
Jenny, I notice it's gone 11 o'clock and I've got 2 other councillors wishing to ask a question. Is that possible?
I can hold fire till 5 past if that's helpful, Chair, and I'm very happy to come back as well, so no problem.
That's excellent, Jenny, thank you. In that case, I'm only taking 2 more questions. That's from Councillor Frankham and Councillor Dowden. Councillor Frankham first, please.
Right, thank you. I'd just like to have assurance that the supplies will be perhaps a little bit more frequent. My son's actually a volunteer in Basingstoke, and he's been struck down on at least 2 occasions where there's been no vaccination. The supplies have run out. Is this because they're getting through so many, or what is the reason for that? And also I'd like to ask, I had a resident who was in his 80s and was given to go to High Wycombe to have his vaccine. Considering that the gentleman had cataracts and didn't drive, we have got him in Basingstoke now, but I'm wondering how often this happens.
Thank you, Councillor. So there's 2 things there. I think with the national booking system, I think when it writes to people, it gives them the option of locations that are within the vicinity of their place of residence. But Basingstoke Fire Station, amongst other vaccination centres, came online towards the end of January. So sometimes people were receiving letters in line with when they can expect to be called up by the central government team. However, because that centre wasn't live, it didn't flag on the national booking system letters that it was an available location for people. So there was a difficult period for some people where they were essentially getting letters saying you can go to Bournemouth or Surrey or wherever, when actually there was something a bit closer to them which wasn't quite live yet. So there was definitely a timing issue that should be resolved now, because all those centres are live and everybody can book wherever they want to. So if there's any issues with that, please do email me directly. I'm very happy to pick up any concerns about individuals, and certainly wanting to hear from anybody that is in that age range or any particular health vulnerabilities that hasn't been in yet and really must. I would urge anybody to call in. The National Booking Service is open to all of those individuals, so all they have to do is log on, give their information. They should be able to book in any of our locations without any hesitancy. So if there's a problem, do let me know. And your second point about supply and demand, I think, to be fair to our national colleagues, the aim of the programme is very much to vaccinate people in the right order because of the high clinical risk to each of those groups as we go down through those cohorts. So we must make sure that our most vulnerable people are vaccinated in the right order to make sure that we keep our focus very much on that clinical risk. So over the last 2 or 3 weeks, we have been trying very much to make sure that that capacity is ring-fenced for those groups before we move on to other cohorts, because we must make sure that there's enough of those people coming through. I think the supply of vaccine has been a challenge. It hasn't run out at any point, but it has been difficult to align the amount of vaccine coming into the country with the amount of capacity we've got available. And we haven't wanted to stand anything down because we need that capacity as we go through. And all of our vaccination centres are very much full this week and motoring through lots of people. And as I say, open and on the national booking system. So if you're in the right group, please do book on, or publicise that message wherever you go. Lots of comms going out this week as well about that specifically.
Jenny, it's Maggie here. I'm just thinking, do we need to make sure people know how to get in touch with your team if they've got some queries? Because these things are often so easily solvable, aren't they? Do you want to put the details in the chat box?
A contact email address in the chat bar for you.
Yeah, brilliant.
Yeah, that's extremely helpful. Thank you. I hope you're not going to be inundated by emails, but it's obviously useful to be able to pick up problems and nip them in the bud if you can. Last question, Jenny.
Right, can I just come back, Chair? My son, who's a volunteer, is actually in the room, although he can't hear because of obviously my loop. But he wanted to say that it's an absolute joy to volunteer and how professional everybody is. And he wants to thank everybody from that's involved.
Very much.
Thank you, Jane. That sort of input is extremely useful, and I'm sure that is probably the experience of many volunteers. Right. Last question then from Councillor Dowden to Jenny.
Thank you, Chairman. Thank you, Jenny. The vaccine rollout has been a great success, but I think a lot needs to be said as well, of course, in regard not only in regards to the NHS, but the pharmacies, the army and the fire services. They've all played a part as well as volunteers, and they all need recognition for what's been achieved here. And I just, on this particular issue, I really want to pay tribute to the NHS and all those other organisations that's achieved it. And thank goodness for that. That's all I'd like to say.
Thank you, Jenny. I think we can let you off the hook now. You've already volunteered to report later, and because vaccination is our primary weapon now against COVID, we'd be very grateful if you would commit to coming to our succeeding HASCs to keep us up to date on what's happening on the front line. So thank you very much indeed.
Thank you very much. Happy to help.
Right, we can now revert to item 7, and we left questions with, I think Councillor Dowden had a question.
Yes, one
in relation to item 7. Councillor Dowden.
Thank you, Chairman, to Maggie. Obviously, as I said, there are concerns about where at one time we had a health authority, then we had a load of primary care groups, and then we had a load of trusts, and then we got down to a few trusts, and now we go into one, almost like going back to a health authority again. Maggie, can you assure me and the people that I represent that this change again is not going to take any money whatsoever out of the health service by paying off people or whatever, because it has worked well with the West Hampshire and the North Hampshire. So, you know, there's reservations why further change is needed. But can you give me an assurance that, in other words, no money is going out of the health authority, it's out of the health service as a result of this change?
Okay, thank you for that question. In previous times, I think it's fair to say when reorganisations happened, you know, people did, you know, lose their jobs, and it was done as a reorganisation, people put at risk, etc. That we're trying not to do that at all during this. And you'll notice actually in the white paper, which is heralding further changes from April, it talks about really supporting staff and giving them continuous employment. So inevitably there may be a few small changes relating to people's employment status, but essentially this is about getting focused on the job. It's getting focused on building on COVID and the way people have worked during COVID, improving outcomes, reducing inequalities, and doing this scale and local with kind of ruthless intent in both levels. And we've got a lot to do. People are very focused on doing that, and so we will not be losing staff. The idea of this is not to make huge reductions. The idea is to use our people and get them really focused on the issues that face us, both locally and at scale across Hampshire and the Isle of Wight. And the ethos of it all is about, yes, Hampshire, Southampton, the Isle of Wight, CCG coming together, but with a really deep delegation to our local clinical directors and our managing directors in each of our places. So very happy to continue to be challenged, and our results will need to talk to what we've done. But we hear people's concerns. Equally, there are groups of people who tell us that the existing CCG structure wasn't always good, didn't always focus enough because it was too complex. So as all, we've taken all that feedback, and I hope we'll be able to deliver a way of working that will make all our partners feel more confident, and that's what we intend to do. But thank you for your challenges.
Thank you, Maggie. I'll leave others to question now. Thanks. Thank you, Maggie.
Next question comes from Councillor Cynthia Garton.
Thank you very much, Chair. Yeah, just a quick question really for Maggie. Our local area committee in Hedge End, Botley and West End recently opened up dialogue with the West Hants CCG, and we've been very grateful to have representatives from them come to our meeting. They recently gave us results of a survey that they carried out in the easterly southern parishes, and basically that confirmed, I think, what we knew anyway, that they're looking to have a health and wellbeing hub centred on the Hedge End and Botley area. Now, I know you've mentioned about the fact that this could be more local in what you're doing now, but sometimes people have different definitions of what local actually means, because looking at the map, it is quite a big area. So I really would hope that though this work will continue as the West Hants CCG merges into the bigger CCG, and then it doesn't get swallowed up, so that these things will continue and we won't just see them disappear. Maggie, thank you.
Yeah, could I just really reassure you? Of course, West Hampshire was one of our bigger CCGs, covering quite a huge geography, as you say, from Hedge End down to the New Forest, Winchester, Andover, etc. So we're really keen to make sure that we focus on real communities, real place, not administrative boundaries put in place by the NHS. And actually Alton's a really good example of that. Alton is in our North and Mid Hampshire space, but Alton has its characteristics, just like Romsey does, just like Andover, Gosport, and so on. So we'll work this through with you and many others, so that you will see us being much more active in those very local spaces, continuing the good work that you talk about, and recognising that in some places we've got more to do, working closely with public health as well, and all our partners, so that we get this right, so we get health and well-being and outcomes improved across our patch.
Thank you, Maggie. Thank you, Chair.
Thank you. Next question comes from Councillor Thornton.
Thank you very much. Just quickly, Maggie, improving and enlarging and making everything fit together better, it's great. And we seem to be heading sort of almost back to regional health boards of many of our memories. The question is, though, is that we don't know exactly what the government's going to do in a couple of years' time reforming the health service. So are you not perhaps taking a bit of a risk in setting up something which a government in a year or two might knock down and that way mess up your plans? I mean, I think your plans are great and I approve of them 100%, but I'm just a bit worried about what the government might do if you move this too fast.
Okay, yes, no, I understand that question. I think the reverse, because the white paper proposes that CCGs as currently set up won't exist, and their functions and their statutory responsibilities and of course their people will be part of a proposed statutory ICS or an integrated care system, and for us that would be Hampshire and the Isle of Wight. So we hope that we're taking a step towards that, so actually far from be risky, we're actually de-risking it and making sure we get in the right space and be ahead. So that's our hope. But as always, as public servants, you know, we have got our job to do, and we you know, we try to be as ready as we can for whatever we are asked to do by government.
Thank you.
Thank you. Next question comes from Councillor Jonathan Kenty.
Good morning, Maggie, and thank you for your presentation. I just wanted to ask about the proposals to establish the ICS board over the next year. And although it's at a very early stage and it's dependent on these reforms going through Parliament, whether you've had any thoughts about how local government, whether it be Hampshire or districts, and the voluntary sector might be represented in those new structures that are going to be emerging.
Yeah, no, very good question, and it's very much on our minds. So pre the white paper, the Hampshire and Isle of Wight ICS was authorised at the back end of last year, and that was very much on our mind already to set up those partnership boards and to make sure that we did exactly as you say, make sure we get all that representation right. In the white paper, it talks about not only the ICS as a statutory NHS body, but it also talks about the ICS as a partnership. And we think, and we'll need to come back to this, but we think there will be a lot of flexibility, but there will be some nationally prescribed membership, and we will want to do that. And as always, you know, we've got to make this work so it makes sense, that we don't duplicate. We need to work, of course, really closely with the Health and Wellbeing Board, both across the county, but also at the district level as well. So all those things are very much on our minds, so that we get all the right people involved in what is really trying to integrate care, integrate our input, and quite frankly, just really improve outcomes for the people who we serve in our geography. So I think we should really come back to it, and I think over the next few weeks we'll hear much more centrally, but also everything we're hearing says that although there will be some legislation and there will be some demands, there will also be a lot of flexibility and freedoms. And I'm really keen that across Hampshire and Isle of Wight, you know, we know our geography, we know our populations, and that we step in to do what's right for us. And I hope there will be the opportunity to do that. So really look forward to the conversations about how to get this right.
Thank you. Councillor Tony Craig.
Yeah, thank you, Chair. It was just following on really partly what Cynthia said, but I do have some real concerns. Eastleigh Borough, we do work really closely with our CCG, and we help with, you know, trying to build surgeries, all sorts of things to work closely for our residents. My concern is we keep talking about localism and making things available for local residents. I'm concerned we've got a surgery out at the moment that's being covered by another one. That other surgery is already struggling with the patients it had and has put in planning applications for developing its site, which it can't really. There's nowhere really to develop it. taken on an extra 4,000 patients. If it couldn't cope with its patients before, how on earth does it cope with another 4,000? And trying to work with CCGs to try and get that covered has been absolutely impossible. And I just feel for the last probably 5-6 months, I've been palmed off, keep being told that local services really matter, but just getting nowhere. And it was interesting. I did laugh, Maggie. I mean, no disrespect to you, but it was when you said to one of the councillors earlier about having a conversation offline. I've had that so many times, and then I'm told something offline, and then there's nothing to scrutinise it later. I think we need to be really, really careful about having those conversations offline, because there are real concerns locally. You know, I am concerned. For example, I've been trying to get an appointment with my GP, telephone one, for the last 2 weeks. I phoned again this morning to try and get one, to be told to phone back at 12 o'clock, and it just goes on and on like that. I'm concerned that people are unwell, they're being left too long and become further unwell. Some of it could then potentially be critical illness we're going into. You know, it's just real concerns around the whole lot. People are too busy to sit on a phone and phone in the morning, and then again at lunchtime every day for weeks to get an appointment. And it just really, really concerns me. Thank you.
Well, no, thank you. And I am really aware of those practice issues. So we're in some very active conversations with Nick and his team. And I am really sorry that the part of the CCG infrastructure West, you know, I'm sorry that you report things are not as well as we would want them to be. And you know, inevitably there's a lot of detail, and you know, if you want us to come back on some specifics, particularly around primary care in each of the patches, we'd be very, very happy to do that, because obviously each specific area has got different issues, all of which are really important to resolve, as well as some generic issues that probably go across the piece. So probably we won't say any more now, but we would be very happy to come back here, and I don't mean offline as in some unaccountable way, very happy to have direct conversations as appropriate.
I think it's really important that we do that, because Maggie, I have, and it's like I say, no disrespect to you, but I've been having these meetings monthly for, in actual fact, it's at least a year now, and you know, kept being told that contracts were being sorted, that a surgery was taking over properly, and the contract actually runs out, that particular surgery, you know, runs out next month, and there's nothing in place to continue that. And it is in one of the most deprived areas in the borough. So it really is concerning.
Yes.
Thank you.
Thank you.
Members, I think we've probed this particular topic very well. I'm aware that there are 4 other councillors who wish to ask questions. What I am proposing is that you email those questions, because we have a commitment from Maggie McIser to come back at our next meeting and explain further. And I think in the interest of time, we and therefore are holding up our NHS colleagues, we need to progress. So can I ask you please to email your questions, and there's no reason why offline conversations cannot also be reported by email, and it will be available on the record. So Maggie, we need to go to the recommendation of your 6B. I would like at this point to congratulate you on getting this far of integrating the CCGs across Hampshire and the Isle of Wight. And let's hope that one day Portsmouth will join in for the common good. Now, I quote from the Health and Care White Paper referenced in your paper, where it recognises the extraordinary dedication, care and skill of the people who work in our communities and our hospitals. It has been unwavering, serving as a reminder once again of just how precious our health and care services are to us all. I think we can all agree with that, and I'd like us to agree noting your report to us this morning, and we look forward to hearing more. I would suggest an appropriate time would be during one of the autumn HASC meetings. Is that acceptable to members?
Agreed.
I'm not getting any dissent, so that's good. Are you happy with that, Maggie?
Yes, very happy. Thank you very much.
Thank you very much indeed for your attendance, and thank you also to Jenny, although she will have disappeared by now. So thank you. That concludes item 6. I did refer to item 6 as item 7 earlier. That was my mistake. I apologise if it caused any confusion. So now we can go to item 7, members. Thank you. Item 7 is the Public Health COVID-19 update. To receive a presentation from the Director, Simon Bryant. Simon, are you with us?
Good morning. I hope I've just come on screen. Has that worked?
Yes, I can see you. Go ahead, please.
Many thanks. And with your permission, Chair, I will share a presentation of the data. And apologies to the committee. I was writing it this morning, not because it was last minute, because as you all know, the data changes, and I wanted to give the committee the most up-to-date data. So I hope that is on screen for everybody.
Yes, we can see that. Thank you.
Great. And I've presented before. I'll go through a similar presentation. This will be some of the data, and then I'll update on a few issues. I will very quickly touch on some of the issues we're dealing with on vaccination, not to cover the ground that Jenny and Maggie previously covered, but I'll just go through the presentation. These maps I really show the progression of the pandemic across the country, and we can see now that the rates have come right down. Now that with our patch less than 100 for the whole of Hampshire, with some variation across different areas, but in the main we're at a rate of under 100 per 100,000 for the 7-day rate. So really important rate to look at, because that shows how it's spreading. We can see that that's not inevitable. We can see some areas with higher rates, Peterborough, for example, and other areas where the rates aren't coming down. So we are in a really good position, and we know that some of the other ethnic groups, the rates aren't decreasing as much as we would like. So when you look at the southeast, and some of the dates are slightly different, just the way the data comes out. I can only apologise for that, but I'm just giving you a general picture. And what we need to see is the rates are coming down and below 200 for the population, and for many now below 100. Our R rate is between 0.7 and 0.9. And just to again remind the committee, that's an R rate for the southeast. We don't have anything for less than the southeast of England. It's just not a figure that is robust enough. Then moving on to kind of more local, as I'll come through this presentation, we can see, as we call it, ceremonial Hampshire, we can see that Portsmouth, over the course of the pandemic, its rate has been the highest in near England, followed by Southampton, Isle of Wight and Hampshire at the bottom here. So this is across the pandemic. We know that Hampshire has had the lowest cumulative case rate, which is really positive. However, this graph shows that has been 60,000, nearly 70,000 people who've had COVID over the time of the pandemic. And we can see again on one day we had 1,659 cases. This graph does show that it's coming right down, and we can see that's falling off. And that's because we are in a lockdown, and the lockdown means that people aren't mixing. When people don't mix, the infection can't spread, and that's really important to think about that. And then again, if we look at across our districts, we can see, and Gosport's come down. I'm afraid I couldn't get an updated map, to 103 now, so slightly out of date, but you can see all the rates are coming down, and Rushmore, which has been higher for some time, is equally falling. So I've got the updated rates for each district, with Gosport at 103.7, and our lowest district is Winchester at 30.4. So again, even since this data and these maps, the rates have come down, again, really positive. And what we now find is that any small outbreak in a care home or a setting, or even a family of 6 people, that will put the rate up slightly, because we're in such a good position that our rates are coming down. And then you can see the dark blue line is looking at the over 60s rate compared to the all ages rate. And that's really important because we know that those are the rates when they go up, that will cause hospitalisations. And you can see here, compared to England, a rate of 107. South East is 7-day rate of 73.1. I put Yorkshire and Humber on because they are the region with the highest 7-day rates. Again, really important, and you can see the figures here. And again, when we look at our age group, it's in mainly that very old age group and then that working age population. Just good to look at that age band so we know who's most at risk. Again, slightly out of date, but you can see when you look at week by week, some of the rates fluctuate up and down, but you can see all in all a drop, which is really positive by 18%. Again, the hospital activity data is really important, and we see that come right down. It hasn't been updated this morning, but we can see that in the main hospital, people admitted to hospital, the numbers are falling. For hospital data, this is people in hospital rather than our population, because that's about the capacity. Southampton particularly, obviously it takes people from the West Hampshire, New Forest area, but it also is a major trauma centre. So it will take patients with COVID from Dorset when their hospital capacity isn't quite as great as what we've got. But then when you look at ventilator capacity beds, so these are people in critical care, those numbers, particularly in Frimley, Portsmouth and Southampton, are a little bit stubborn. So we know that we need to keep an eye on that and make sure that we continue to see that fall. It's coming down, but not as fast as we would like. And then let's move on to, sadly, we know mortality. So 85 deaths in the last reported week. We can now see this green diamond shows the 5-year average, and we're now, for the first time in a number of weeks, our excess deaths are below that of the 5-year average, and we've seen our COVID deaths considerably fall. So whilst we know we'll still see deaths going forward because there is a lag, it's really encouraging to start to see our mortality rates fall. And this just gives a summary of that. The other figure that I haven't talked about a little bit is the positivity rate, which is the number of people testing positive as a percentage of the tests taken. And that's now, they're all now much lower, up in the well over the kind of 15% at some point. So that's really good. A couple of other issues I'll just share with you. First of all, community testing. We have set up a community testing program for those without symptoms. Sorry, it's to launch. It has launched on the 22nd of February. It's an appointment only scheme delivered by us in consultation with the Department of Health and Social Care and our districts. We've got a number of sites there and we are reviewing that program. We wanted to get it up and running really quickly. We had about 3 weeks to write our bid and get that through. But as we talk, the government's announced a slightly different approach, which we will adapt our programme to deliver. So this is for people who have no symptoms, who are going to work, to be able to get tests twice a week, to pick up anybody who is positive and doesn't know it because they haven't got symptoms. And we know about a third of the people who have coronavirus don't have any symptoms. So we've now just been told about a new programme about twice weekly testing on the lateral flow tests again. So those are the ones that results come back quickly for full households of primary, secondary and college age children. We were told about secondary school children on Thursday last week, or earlier last week, and we were told about primary schools late last night. So it's hot off the press. We are going to deliver this programme, understanding what that looks like and how we take that programme forward for those people who are in households of children at school. Another way to help prevent and break the chain of infection. Finally, on testing, surge testing, you'll be aware there was a single case of the South African variant found in the Bramley area north of Basingstoke. And as the County Council, we undertook surge testing and we delivered 2,878 kits to people's homes. We did door-to-door testing and a very good return, around 90% return rate, really positive. We are waiting for the results of the genome sequencing to find out which strain there has been. But at the minute, people will get their results back and we'll wait for the genome sequencing. But that went very well. Really pleased with that way that programme landed, and the population took that up with real enthusiasm. So that's really great news. If I very quickly, I'm going to do one slide on vaccination, thinking about equity and inclusion, as Jenny has talked about, really good work on improving uptake of the vaccination programme. The County Council, with its Insight and Engagement Unit and public health teams and others, are working to really understand what further work we need to do to encourage those who aren't uptaking the vaccine to take that up. And that might be various reasons around cultural issues, or these people are less likely to take up services. We might think of our drug and alcohol clients, or those who maybe have more chaotic lifestyles. So we're doing a lot of work there, and the CCG and the County Council are working together to develop that programme and see what works best, maybe a kind of roving programme. Think about supportive outreach. So we're doing a lot of work there. And you can see the different ethnicities. I know it's a big area, Hampshire and Isle of Wight, across that, the number of people we need in these populations to have the vaccine equivalent to the general population. So we're just working through that data that we received last week. Finally, very quickly, because it's been all over the news, this is the government's roadmap for coming out of lockdown. Really important that whilst we're in this position, we still manage our social distancing and all those kind of things. But we know next week we'll see schools and college open again, and we can still exercise with one other person. We'll move forward to have rule of 6 outside on the 29th of March, and outdoor sports and leisure meeting again. And then after 5 weeks, it's really important that we do take this steadily, see the impact of each step on how that's impacting on the prevention of infection. And we've got these on the right hand side. These measures will be coming in place no earlier than 12th of April. And then following that, no earlier than the 17th of May, there'll be some more steps. So indoor entertainment and attractions, outdoor limit to 30 people. And then finally on step 4, no earlier than 21st of June, will be hopefully we'll be releasing people further in terms of the lockdown and taking that action forward. But we need to be really careful and mindful that we are likely to see a spread of infection as people mix, because this virus hasn't gone away. The vaccine programs are a real light at the end of the tunnel, but still people may be able to spread it. And up to July, we'll still have a huge swathe of the population that hasn't been vaccinated. Councillor Huckstep, I will stop there. As always, happy to take any questions.
Presentation. Thank you, Simon. That was an extremely comprehensive set of slides, a lot of detail in them. You'll be putting that up on ModGov forums, will you?
Absolutely. And just to remind the committee, the data is on our website every week, so that's accessible. Yes.
Yes. Now, what I'd like to do now is go to item 8, because that's also COVID related. And after item 8, we'll have whatever questions people have relating to the COVID-19 situation. So can I move on therefore to item 8? That starts on page 37 to 70 in your packs. And we're going to receive an update from the NHS Commissioners in Hampshire, providing an update on developments in the COVID-19 NHS response in Hampshire since the last meeting on the 11th of January. And we've got 2 presenters. We already heard Jenny Owen talking about the vaccination programme. So that now leaves Dr. Andrew Bishop, who is Hampshire and Isle of Wight COVID-19 Clinical and Medical Acute Lead and Interim Clinical Transformation Director. Andrew, are you there? Dr. Andrew Bishop, are you there?
Chairman, I can't see Dr. Bishop on the call. I'll just see if I can get hold of him. Do you want to take questions on the public health update while I'm trying to find him?
We'll do exactly that, Marie. Thank you. So questions, members, on the presentation you heard from Simon. Yes, I think I've got a question from Councillor Cooper, Councillor Rod Cooper.
Yes, thank you, Chairman. Simon, you referred to the Frimley figures there. Can you confirm, please, that the figures that you've given are for the whole of the Frimley site, which covers the two sites, one of them being Wexham and the other one being Frimley? And is it possible, if that is the case, to break down the Frimley figures individually? Because obviously the figures are a little bit higher, especially the ventilation beds situation, and I think it would be useful to know from this committee's point of view what the situation is on the Frimley site itself, leaving Wexham out of it.
Thank you, Councillor Cooper. Unfortunately, the NHS figures do it by hospital trust, so they can't break that down very easily for us. But we do look at, because we work as a system, so it's as a system piece of data. I can work with my NHS colleagues, see what I can get for you, but that's the public data which I presented here. But let me come back to you with some more specifics.
Thank you, Simon. Executive Member for Public Health, Councillor Judith Grasky, you want to say something?
Yes, I do. Thank you, Chairman. It's a comment. I just want to place on record in this public forum my thanks to Simon and the whole of the public health team at Hampshire County Council for the work that they're continuing to do. I'll pick out, first of all, the surge testing, which was an exercise conducted with, well, military efficiency and quite literally, and with, you know, a huge amount of dedication. Also to setting up the asymptomatic testing sites, some of which are in libraries, some which are being run by district councils. But, you know, that was a huge challenge, and it's all going very well. And Simon and I met this morning, and one of the things we discussed was the importance of keeping on with the message to people that even if they've been vaccinated, even if they've been vaccinated twice, they should still follow the rules, because I'm hearing that there are people who think because they're vaccinated and the people they want to go to tea with have been vaccinated, they're okay. We must all keep following the rules. As Jonathan Van Tam said at the weekend, we've all been to the match where we've lost 4-3, and now is not the time to let up. Thank you.
Thank you, Judith. Echoing the national mantra. Well done. Right. I think I've got a question from Councillor Buckler.
It sort of follows on from what was just said, actually. It's not just about the people that have been vaccinated and actually think they're safe and actually could pass the virus on. I've had many conversations with lots of elderly people now that go out in their droves to Tesco's and other supermarkets and just literally wander around, whereas before it was fine. It's actually now the weather's got better again as well, and now that the messages have come out from national government about, you know, on the 8th of May this can happen, and the roadmap that's going through, a lot of people have seemed to start letting their guard down. And the weekend I was out, I ended up having to actually had to call the police in the end, because there's lots of children out, well, say children, youth of about 17, 18, out in their herds, drinking on public spaces, loud music. I'm not going to carry on with anything else they were doing, which was quite undescribable at the time. I did actually approach one group, and I said to them, you know what, you know, you're not being very responsible here. I got a load of verbal abuse, but I do fear that as the country starts to relax, they're going to relax. I know we're putting out, the county's putting a load of stuff out, the districts are putting a lot of stuff out, as is the primary care networks and everything else, but I don't think the message is getting through, and I'm not quite sure what else we can do about it. But it's something I think we need to really consider. Otherwise, as you quite rightly say, Simon, we could be back to where we started from just before Christmas, and that's something that the country can't withstand any longer.
Thank you very much for those comments, really helpful to hear. I think just firstly, to take your last point, you know, the difference now between what we had before Christmas is we've got a vaccination programme, which is really encouraging. But at this point in time, as Councillor Gruevski said, we just need to be really mindful that actually we have got a population that isn't vaccinated as well. So we are mindful of that. And we've done a lot of work within the County Council around targeting our messages, which may not reach you and I because we're not the target audience. So using Instagram, Snapchat and places like that. So we have done a lot of work to promote that, but you're right, we do really need people to carry on with the really difficult behaviours, and you know, and publicly I'd like to thank our population of Hampshire for, in the main, following those guidelines, which has brought our infection rates right down. As I said, that's not happened everywhere in the country, and it's really encouraging, and let's keep that up. But appreciate your comments.
Simon, following on from what you've just said there about social media, some of you may have seen on the back page of the Times today, Facebook's advertisement where they're working with, they say, 100 governments and other organizations. I wonder whether we can tap into that and get our messages across using the Facebook platform. I don't know whether we may be doing it already, but it looks as though Facebook is making a big effort worldwide to promulgate messages about COVID-19.
I haven't seen that, but I will pick that up. But we are using Facebook for some of the populations that use that. And Facebook's really helpful because you can target it to geographical areas, different demographics. So yes, we are doing that as well, but I'll have a look at what you've seen on the back of the Times.
Thank you. I've no more questions for Simon. So Marie, do we have any news on Dr. Bishop?
Apparently he's been having technical difficulties joining the meeting. He has been trying.
Okay.
I've tried resending him the link. I think he's just trying to join now. Let's see.
If he isn't, we'll go to item 9.
Dr. Bishop, have you been able to join?
I've just found my way back in. Many apologies. I got ejected just as things were starting up. I'm sorry. I haven't noticed what happened the last 10 minutes. Have I missed the slot?
No, you're on now. Welcome to the HASC, and do please fire away. We've obviously heard Jenny Irwin earlier, so it's all yours.
Thank you. I am going to turn my camera off, Chairman, if that's all right, because the IT here is giving me some trouble, but I will do that. So this is just a brief update, and of course you have a paper to support this. And listening to your conversation before, what I am going to give you is some fairly upbeat news about the health service. But what I would want to recognise, first of all, particularly in view of your previous conversation, is not to underestimate the challenge of people who are actually trying to access our services, whether that's in primary care or any of our other places. The fact that things are feeling better inside the health service, of course, doesn't mean that we're not aware of the very great challenges people have in trying to use our services. And when we were having this conversation last, we were in the throes of an escalating pandemic, and you will know from the from all the national news that is on the wane, and that is definitely true in Hampshire, Isle of Wight. Just to give you a picture of that, we have about 3,000 hospital beds in Hampshire and Isle of Wight, and at the peak of the pandemic, 1,000 of those had COVID patients in. That's now about 400. We have about 110 intensive care unit beds. At the height of the pandemic, that number in intensive care was about 200. It was twice what we had, and that number is now down to about 110. So, and half of those are with COVID. And we were having nearly 100 people a day turning up at our hospitals with COVID, but the answer now is about 10 a day. So we're definitely in a pandemic, certainly in the hospital, where things have improved. And one of the things I'd just like to mention is, even in the height of the pandemic, because of the work, particularly of our colleagues in Southampton and in Hampshire hospitals, we were able to accommodate people from elsewhere in the country. And in fact, 27 people came as critical care transfers from all over the southeast because they were running into capacity elsewhere. So that was at the peak, and we have improved. There's been a lot of exciting new developments during the course of this that have been very effective. And I'd point out, particularly in community and primary care, the existence of large numbers of people in what's called virtual wards now, who've avoided having to come into hospital and have stepped down as a result of being intensively cared for at home, and particularly the ambulance service, who have really been very interactive in trying to make sure that they do what's called intelligent conveyancing, where they have conversations about the best and appropriate treatment for people. So that situation now feels very good. We are about to embark on the next phase of this, which is starting to restart more normal business again. And you will be aware, of course, that the challenge of that is in all areas. I'd point out particularly mental health, where the challenge not only of the backlog of conventional care, but also the new care that's associated with COVID, and not underestimating the mental health impact in some of our staff is a significant challenge to our mental health people. But they, of course, are working much more collaboratively and now and are addressing that. In hospitals, the big issue is, of course, the number of people who are waiting. Just to give you a feel for that, the number of people on our waiting list in hospitals is probably not that much different to how it was a year ago, but it's the profile that's changed. So of the people who are waiting now, more than 10% are waiting more than a year for their appointments and their treatment. And that's clearly a very major issue. And of course, none of our hospitals are really yet starting to motor through that work. So that will be the most pressing issue over the next 6 months. And as an approach to that, as well as all of our hospitals trying to maximise the amount of work that they're doing, we are still making use of the independent sector and would plan to continue to do that to enhance our capacity. And our hospitals are now talking about jointly rather than severally trying to address some of the issues of particularly long waiting patients, for example, waiting for hip and knee replacements, or waiting for urology treatment, or sometimes dermatology, or sometimes ophthalmology. Long waits for those people. And we're thinking about innovative ways of working together to create more capacity to deal with this. So pandemic waning in the health service, a big challenge of backed up work. The last motif, of course, is everyone knows that our staff in health have worked very hard in this period. And there is a very careful regard to making sure that we don't just motor into the next phase of this, working people very hard again and recognising the need for people to recover. That's a whistle-stop tour of health services here, Chairman. I'm happy to take questions.
Thank you, Dr. Bishop. That's excellent. Are there any questions from members? I don't see any at the moment. I think the written reports were very comprehensive, and you've given us a smart overview of what has been happening. Obviously, some of the charts in the papers are now out of date, but I noticed that most of them are trending downwards, and from what you're saying, they're continuing to trend downwards. Is that correct?
That is correct, and even this morning's trends would show the trends that you've seen there continuing. So things are even better than they were in the paper. Yeah.
So we're all extremely grateful to the efforts of the NHS in this matter. A question has popped up. Councillor Carew.
Thank you, Chairman. Just a very quick question. When we had our last meeting, obviously we were at the very height of the virus, and particularly the new variant. And I remember being told that Surrey, and in particular Farnham, which is literally just over the border from us in East Hampshire, had not only run out of hospital bed space, but also morgue space. If, for example, we find ourselves with perhaps yet another variant, or once the restrictions are relaxed and the numbers start to accelerate again, as they inevitably will, but hopefully by that time most of us will have had a vaccine, are we going to be sufficient in terms of both bed space and morgue space? I know Surrey had to set up emergency morgues at one point because they simply had run out.
Thank you. Yes, I don't know if Simon is still on the line, but for brevity, shall I take that? Although morgues are not quite my area. Beds, but beds and space. Simon, I can see you there. Is there anything you wanted just to say about that? And then I can talk about the beds business.
Thank you, Andrew. On the mortuary capacity, we did set up our temporary mortuary in Hampshire because you're right, we were concerned about that, and we have used that. and you know, so we were prepared for that. But going forward, we're looking at the modelling, and with all the vaccination, as you said, we are not planning to continue to use that mortuary space, but we have had to use it in this current wave.
Thank you, Simon. Dr. Bishop, do you have anything else to add?
Well, only to say about beds, this
Yes.
time round in this pandemic, we didn't run out of beds. We were quite tight at some stages. I think all of the modelling that we've seen at the moment suggests that any next wave, it's unlikely that the hospital demands from a next wave, unless it's very different to how people are modelling, is going to be in excess of what we've lived through now. So I think we were very close to the edge, but we didn't run out at this stage.
Thank you for that. I don't have any more questions, so it remains for me to thank you very much indeed for attending yet again and giving us an update of what is happening. It's highly important work. We know that your staff are working at 110% and it must be taking its toll, but we hope that you can carry on as long as it takes for this pestilence to subside to virtually nothing. So thank you very much indeed.
Thank you, Chair. Thank you.
Our recommendation is obviously to update, to note your update and hope that you can report back to us at our next HASC, hopefully with even more declining figures. Thank you. Right, members, we can move on to the next item on the agenda, which is item 9, which is Adults Health and Care COVID update. And that will be a presentation by the Director of Adults Health and Care, Graham Allen. And also we're getting a presentation from Jess Hutchison. I think I get the impression from the order of things in our papers. Jess, are you going to go first? Yes, you are. You already put your first slide up on the screen, so please go ahead and welcome.
Thank you, Councillor. So I'm going to update then on Adults Health and Care's response and recovery. You won't be surprised to hear that the increase in COVID infection rates in December has led to a further intense period of activity operating through our emergency structure. We've been supporting services through outbreaks and staff shortages, and carefully monitoring our responsibilities under the Care Act, including safeguarding activity and staff attendance, as well as levels of assessment and review. We have been particularly mindful in this time of older people and people with disabilities living with families who have gone through another period of paused care, and supporting those who need it in the best way possible to reduce the risk of infection whilst giving people services as required. We are supporting and welcome the new implementation of national testing regimes during this period. For example, supporting work going on around testing of personal assistants and looking at the future testing that needs to be applied in day services, alongside operating schemes in domiciliary care and supported living, as well, of course, as care homes, which Graham will come on to talk to in a minute. Also, an important aspect of this has been providing funding for the market to reflect the time taken to maintain a successful testing regime, and even offering a small amount of support to families' carers, financial support, given the disruption to their services. I think the other thing to mention is we have been engaged in a real flexible response with redesignation of a number of staff to support key elements of business, for example, hospital discharge, and also the vaccination programme, which I'll come on to talk to in a second. So the welfare response to those who are clinically extremely vulnerable has continued with ongoing support and thanks to the voluntary sector and districts. As you may know, the national shielding advice is in place until the 31st of March. with people still advised to remain at home. This group has been added to. So there's a new group of clinically extremely vulnerable people that have been identified where the local authority will have responsibilities for them. It's a group of approximately 30,000 people. And that they have been identified on the basis of a risk stratification tool, looking at clinical risk from COVID, taking into account, for example, someone's body mass index, ethnicity, medical condition, and the postcodes from which they live. So, and one of the things we've been doing is communicating with that group. So we've received 11,400 of those names so far and expecting the next tranche shortly. And so thank you to all of our partners involved in that work ongoing. With regard to vaccination, I know you've already heard significantly around this area this morning. So it's important to say that we've just finished the task of supporting the NHS with the identification and coordination of the social care workforce. And that was prior to the rollout of the national booking system. So there were around 30 staff that we brought into a very short-lived team working to a tremendously fast deadline in terms of making sure that all of our social care workforce were vaccinated, and indeed the majority were vaccinated by the 15th of February. So thank you to all involved in that, and certainly really positive piece of work. The national booking system is now in place for new staff. Just to say, we are just involved in supporting the NHS also in the vaccination of unpaid carers, so family carers, and already carers receiving carers allowance are able to access vaccination slots. GPs are in contact, and also the local authority are contacting those unpaid carers known to them this week to invite them for a vaccine, which is really tremendous. Of course, in order to make sure that our services remain resilient and able to support people with disabilities and carers, we want to pay significant attention to the well-being of our staff. And as already been alluded to today, in other areas, we you know, this is a very important area, and we have a number of offers available to staff. I think one element I want to bring out specifically is the requirement to continue to support staff who are working directly within HCC care to deal with the psychological impacts of COVID, alongside staff in the wider market who've obviously had direct witness of quite tremendous events over the last few weeks and months, and so that group are in mind, and we have a debrief offer and support available for that group. And just finally, whilst we need to be cautious around talking about recovery, it certainly will need to be a focus over the next few weeks and months. We're prioritising, for example, the reopening of day services at this time, in the hope that the vaccination of people with learning disabilities will be completed by that point, and we will also be sure of testing for staff and testing for service users in that area. But there are also big pieces of work already underway with Hampshire Safeguarding Adults Board, for example, and making sure that we continue to support the market. And the recovery roadmap will be developed over the next 2 years. And I will pass over on to Graham to continue on his care home update.
Jess, thank you very much. Sorry, Chair, you're on mute.
Yes, you're quite right. I'm not on mute now. Quick interrupt. Do we want to ask questions of Jess's presentation now, or are we going to have questions in both halves of this agenda item at the end? The reason I'm saying this is I did promise that we would have a break around about noon, and it's 5 past noon now. How would members feel about us asking whatever questions we have of Jess, then having a break, and then moving straight on to Alan's presentation, because he's got another presentation to make even after that. Is that in agreement with members?
Agreed.
Agreed. Yes, okay. So any questions for Jess? Yes, I've got a question from Councillor Canty, Jonathan Canty.
Thank you, Chair. I just wanted to ask about the recent changes in terms of the Shield and Patients list, and whether Hampshire's picked up any, I suppose, different need or support that is required for people who have been requested to Shield at this point compared to people who've been on the list over a longer period, and whether we've got any data on the proportion of people who are on the shielded patients list in Hampshire who, when it comes to vaccination.
Thank you for your question, Councillor Canty. It's important to say that I think one of the predominant reasons for the new list of people who are shielding is around access to vaccination. So one really positive benefit for all of that group is that they will receive prioritisation for vaccination, and we're working closely with the CCG. It's a little early to know exactly what the profile of that group will mean, and indeed we haven't received 2/3 of the list yet. We're still waiting for those names to come through, but from what we've seen already, we know that we are going to see a preponderance of people, for example, from a BAME background, and we're assisting the NHS to make sure we reach all of those people that are where there might be some barriers to receiving their vaccination. Otherwise, I think it's too early to say really what we're finding from that group, because we haven't received all of the names. We're not seeing an enormous need for a volunteer support through that group currently, but it remains to be seen, and it has only been live for the last about 7 working days that we've had. We've known those first few names, so happy to report on that in the next session if that's helpful.
Thank you, Jess. Question from Councillor Adam Carew.
Thank you, Jess. Another excellent presentation. Can you tell me, you've mentioned previously about people who are on this short list who are vulnerable and shielding. Given that all these letters have gone out to people from Hampshire County Council as well as the NHS recently, roughly how long do you think it is before these people will be vaccinated, and how long before they receive a second vaccination should they require one? I guess it depends which jab they get.
Thank you, Councillor Carew. I can say I'm pleased to say that we're already looking to support the new added names on the shielding list to receive their vaccination. So we're supporting the vaccine operational centre already to contact that group, and that they are being invited to clinics as we speak. With regard to the second vaccination, as you quite rightly say, it does depend on what vaccine you have, but also what part of the system you have accessed your vaccination from. But certainly, they will receive that second jab within the time scales that they should.
Thank you.
Graham, you wanted to say something.
Yeah, just really to follow up in terms of the additional individuals that we've been notified of in terms of their clinical extremely vulnerable status. So the 11,400 people that we were advised of just over a week ago, it's based on research undertaken in terms of impacts of COVID, and it includes people in particular postcodes, people that may be obese, and people with other characteristics not previously identified as being at particular risk should they contract COVID. So 11,400 people under the age of 70 and a further 19,000 over the age of 70. It's important to say that those over 70 should hopefully have already been called forward for vaccination already. Those under the age of 70, depending on their age, may have been called, but we as a local authority have been in contact with all 11,400. But by the nature of that list of people, some of them will be in hard to reach groups. So people not necessarily in contact with a range of services that may be reluctant for a range of reasons or struggle to engage with services. So the effort undertaken should not be downplayed in terms of that group. I know Jess said we're getting relatively few requests for practical support, whether that be with regard to food or prescriptions, for example, but it doesn't mean there isn't a huge amount of effort going in to make sure that we're making contact and we're following up with that group of people, and also making sure that they're seen as a priority in terms of vaccination if they haven't been already. The other comment I just wanted to make, and it's down to the skill of Jess's presentation as much as anything. I think Jess, and you may have formed this impression yourself, Jess has sort of glanced swiftly and lightly over a huge amount of work across a range of different areas of activity. And I just want, please, as the Director of Adult Social Services, to pay huge testimony in regard to the work that has been done, that continues to be done. And given the Chairman's comment earlier with regard to the 110% effort within the NHS, I would certainly say, given that we're working hand in hand with NHS partners, but indeed beyond just the NHS, with a whole range of other partners in district and borough councils, with the voluntary community sector, that 110% is represented just about everywhere in terms of the work that's being undertaken to look after our most vulnerable and to support all Hampshire residents in terms of being able to obtain the support that they've been able to receive in a number of different ways. So I just want to say thank you to Jess and the rest of the team that's been involved in that work. Thank you. Chair, you're on mute again, sorry.
Yes, I'm on mute again. I'm off mute now. Right, thank you, Graham, for those remarks. I'm sure that they are echoed by all the members of this committee. Everybody is working incredibly hard, and obviously stresses and strains will appear, and hopefully we can deal with them. Right, I don't have any more questions on Jessie's presentation. So, with your permission, we'll have a recess until 12:25. Reconvene at 12:25 on your computer timings, and we'll do the second half of this item with Graham's report on adult care. Thank you. Thank you, Marie. Welcome back, everyone. Graham, we're going to resume item 9 with your report on the care home update. Thank you.
Thank you, indeed, Councillor Huckstep. Can I just check that the presentation is on the screen?
I see the first page of your presentation.
Perfect. Thank you very much. So, members, I've just got a few slides to talk to in terms of the care home update. So, in common with previous presentations, this will follow a similar format. So the first thing to say is, following the announcement of government's roadmap last Monday, from Monday the 8th of March, visiting can resume in care home settings in terms of an identified named relative being able to visit their loved one in a care home on a regular basis, subject to undertaking lateral flow testing. So to some degree, from next Monday, albeit on a smaller scale, because multiple members of a family or a group could visit individuals in care homes. From next Monday, one named individual will be able to do that. And as I say, in common with what we saw before the lockdown imposed in early January, that will be subject to lateral flow testing each time that they arrive. The result will need to be negative before they can then go and meet their loved one in the care home setting on a close basis, wearing PPE. Alongside that, visits can also then continue as they have been throughout the current lockdown, whereby individuals can see loved ones through windows in visiting pods, and a visiting pod is a specific space with a substantial screen in between, so the equivalent of a window that prevents infection. We've also continued to work very diligently both with CCG partners around infection prevention control and also with Hampshire Care Association. And indeed, the preparation for visits, albeit on a limited scale, reopening next week, are being undertaken hand in hand, literally as I speak, with colleagues from across the care home sector in Hampshire, as manifested through the Hampshire Care Association and indeed the CCGs. Just in terms of where we are with the impacts on the care home sector from COVID. So these are data from the beginning of April, so all of the data within this current financial year up until the 5th of February. And my apologies for the lag, but I'm sure members will understand that in terms of the lag of data, it's reliant upon that data being made available to us, and also the registration of deaths can also lag behind by a good week or two, given the requirements in terms of registration of death. So what we've seen over the 10 months or so, almost 11 months of this year, is a total of 3,742 care home residents across Hampshire having died through this year. And our thoughts, of course, are with each and every one of those families who've lost someone through this year. And of those deaths, some 849 have had COVID identified on the death certificate, in line with government reporting requirements in terms of within 28 days of somebody being confirmed as having COVID-19. We have seen through January a real spike again in terms of care home outbreaks and infections. Positively, over the last 2 to 3 weeks, those have started to reduce quite significantly, in line with what we've seen certainly in acute hospital settings and across the NHS, and indeed more broadly across our communities. In terms then of representing those deaths in the form of this chart, the red bars are those people that have died with COVID-19, not maybe directly as a consequence of COVID-19, but again, in line with those government reporting guidelines in terms of the presence of COVID-19. And what you will see on the right-hand side of this slide are the numbers of people dying, really as we started to see numbers peaking again through December into January, and then starting to decline. As I say, my apologies, there is a slight lag in terms of this data. It's from the week beginning the 5th of February, but we have positively seen the numbers of deaths reducing, again in line with what's been reported already in terms of outbreaks and infections in acute hospitals, and indeed Simon Bryant's update in terms of the presence of COVID more generally. The levels now, and you will see across the diagram, the green line illustrated, it's a green diamond shaped line. That's the number of deaths over the 5-year period. So anything above that line is to be considered an excess death. We're now at a point where we are below that 5-year average in terms of the total number of deaths. Both people dying through a range of conditions and illnesses, and also people dying as a consequence of COVID. Just in terms of work that continues, again, members won't be surprised to hear that we continue to work very diligently with all partners in terms of reducing outbreaks and indeed supporting the sector more generally. We are seeing the number of outbreaks very positively reducing, and I can say that over the course of the last 2 weeks, we have had relatively few requests from the wider care home sector for any particular support. And that contrasts very significantly to what we saw really through January and indeed through previous peaks of COVID-19 infection, where we were receiving multiple requests on every single day from across the sector for a whole range of different forms of support. As we go forward, and again in line with the roadmap, great care and attention is being given to the transition as we work through in terms of vaccination that's been undertaken in care home settings, both for residents and for staff. And in terms of care home settings, so around about 480 care homes across the county of Hampshire for all client groups. So that's older people and also younger adults with learning disabilities and other life-limiting complications. In terms of the vaccination progress for all residents, and there are almost 11,000 residents, we are close to 93%. Work is still ongoing in a number of learning disability care home settings for residents. As was said earlier, huge amount of focus now, and we saw through last week government changing some of the guidelines in terms of younger adults with learning disabilities being able to receive COVID-19 vaccinations as a priority group. That work is progressing really well. In terms of care home staff, some 20,000 staff working across the care home estate in Hampshire have now had their first vaccination. And that sits alongside the 26,000 staff, which includes also people working in volunteer capacity across the social care sector in the community. So the best part of 45,000 plus staff within the social care extended community has now had their first vaccination. A huge amount of financial support has also been provided. Of course, our response to COVID is about the human consequence and about supporting outcomes for residents. But financial support has been absolutely critical to the sector throughout our response so far. You will see there at bullet point 3, some 58 million plus pounds have been provided to the sector thus far in the form of financial support. Just over 18 million pounds has come from Hampshire County Council in terms of additional payments on commissioned care by the department, alongside more than 30 million of government grants that we've been able to pay out in rapid time across the sector for infection prevention and control. And in terms then, members, of that missing 10 million pounds that isn't included on this slide, that relates to a further 2.3 million pounds paid out currently in terms of social care workforce grant, money that's been provided through the Contain Outbreak Management Fund, which comes to the Director of Public Health, and also Hampshire's CCG's matched the additional payments for commissioned care that we as a local authority made through the first half of this financial year. So more than 58 million pounds. And as I've already said, the vaccination programme across Hampshire and across all of our care settings is progressing, and the work done thus far has been really, really positive. Thank you. I'll stop there. Thank you, Chairman.
Thank you, Graham. That was very, very useful indeed. We've got a question from Councillor Thornton.
Thank you, Graham. You're just mentioning about the numbers of staff that have been vaccinated, but not the percentage of the staff, particularly in the care homes. And also, as part of that, do those figures relate to all care homes in Hampshire or just to the ones run by Hampshire County Council?
No, so firstly, if I take the second part first, thank you, Councillor Thornton. So the figures relate to all care homes in Hampshire. Almost 480, as I said, and there are almost 11,000 residents. And those residents go from younger adults with learning disabilities all the way through to people in older age. In terms of the care home staff vaccinations, it's slightly complicated on the basis that some care home providers are also registered providers of domiciliary care. So their staff may work both in care home settings and also be providing support to residents in the community. So that's why in terms of the care home percentage, it reads across at almost 80% of staff in care home settings, but is then somewhat frustrated by the fact that when we undertook the initial scoping of staff working in community settings, social care staff working in community settings, it was around about 20,000 staff that we identified, both those in regulated CQC regulated activity, but also individuals working in non-regulated activities such as day opportunities. So there's a little bit of a crossover in terms of the care home percentage and also the numbers of people working in community settings. But what I can say very positively is that some 45,000 plus social care staff across Hampshire have thus far been vaccinated. And in terms of the regulated sector, there are around about 38,000 people working in regulated activity. So then that extends out to non-regulated activity and also working across into children's social care settings as well. So it's a bit of a blended figure, I'm afraid, but I'm really, really upbeat about just the number of staff that have been vaccinated. It's incredibly positive.
Thanks, Graham. Can I ask us another question, Chair?
Yes, please, Councillor Thornton.
And the other question I've got, and this is probably something you can't really answer positively, but you might be given an indication. It just seems a bit strange that if all care home residents, I mean, the care home where my father-in-law is nearby, all the residents have been vaccinated, and I understand all the staff have. My wife and I have been vaccinated, and yet there's still going to be pretty hefty restrictions on who can go in and visit. I'm not quite sure I understand the logic behind that, but perhaps I'm just being too optimistic about the effects of vaccinations.
So I'm sure Simon Bryant may well step in a moment or two, but if I perhaps just start. So what we know about the vaccination programme, the results in terms of the protection given from a single jab, and it's important we bear in mind that these are vaccinations that require 2 jabs, but the protection given after a single jab is significantly higher than was initially predicted. But at the same time, it doesn't provide 100% blanket immunity for those people that have had that first jab. And indeed, even after a second jab, it's not total. So there is still a high risk, or a potential high risk, that people could still either pass COVID-19 on or indeed contract COVID. Now, if they were to contract COVID, it may not be at the same severity, but given of the populations that we're talking about, any impact of any transmission would be very significant. And what we saw certainly through the spring and summer of last year, what we've seen through January of this year, is that COVID took hold very rapidly in care home settings. And when one considers in terms of individuals more likely to be living in some of our care home settings, people with dementias, for example, and other challenging behaviours, it's nigh on impossible to say to somebody with a dementia or a challenging behaviour, you must still stay 1 or 2 metres away from somebody, not have contact, remember to wash your hands, cover your face if you sneeze, because by the very conditions, people are not going to be amenable to those kinds of behaviours. So that's where, in terms of the care home sector, it still does remain fragile in terms of any COVID-19 infection or transmission. And that's why the vigilance, and indeed Councillor Grajewski's comments earlier, in terms of needing to maintain all of those protections and all of those things that we've needed to become regularly aware of in terms of conventions, we need to maintain. And that's why at this moment in time, it's a measured reduction or a measured releasing of lockdown in terms of that care home visiting, and probably not until later this year will we be able to see those restrictions being eased more than they are from next Monday. It's still a very fragile and delicate period.
Thank you.
Simon, did you want to add anything to that?
I mean, Graham's very, very comprehensive there. I think all I would probably emphasise rather than add is the fact that someone visiting a home could still bring in COVID, even if they've been vaccinated, and you can still transmit it because it may mean you don't realise you've got it. And equally, as Graham said, the vulnerability of those people in the care home, their immune response may be less to the vaccination. So actually, we need to do all we can at this point to protect people as we do with other infectious diseases. So I know it's really sad, but that's the reason we've got to keep up these measures.
Thank you. And yes, we know that the vaccination, even when complete, is not complete as a protection. So there is that risk. I've got a question from Councillor Craig, Councillor Tonya Craig.
Thank you, Chair. It's only because it was being touched on. How do we get that education out there to those that are being vaccinated, that it doesn't actually stop them either spreading it or contracting the virus? And I ask this because in the last week, I had an older gentleman in one of the big supermarkets stretch across me. And I mentioned the social distancing, and he said, "It's okay, I've been vaccinated." To which I replied, "But I haven't, and there's several that haven't been." So, it's that education. They think because they've been vaccinated, they're okay. They forget about those that haven't, and they don't actually realise that they can still contract it. Thank you.
Simon, do you want to address that?
Yeah, I mean, really helpful comment there, and we're doing an awful lot of work, not only with kind of the big comms campaign, but actually working with the vaccination programme to make sure that the information that they give out to people having had the vaccination is really clear that they need to carry on. And I think what we're seeing is kind of fatigue with the measures, and I completely understand that and how we do that. And I said we have picked this up through our comms, and I'll again pick it up in our health protection board to see what further we can do to focus on those populations that really need that message, particularly those people who have been vaccinated, who have been protecting themselves for so long. But absolutely get that point, and we'll take that on board.
Yes, all of us can help in that, in promulgating to our residents the importance of. I think it was Chris Whitty who came up with the statement that we should all assume that we're carrying the virus, whether we've been vaccinated or not. And if we all do that, we should be able to reduce the R rate. I don't have any further questions for, no, I don't have any further questions for Graham or for Simon. So it remains for me to accept the recommendation that we've noted their report, and we look forward to their reports in the future, where I hope the picture will be even better. And thank you both very much indeed for all the work you do and for all the work that your staff do in combating this pestilence. Thank you very much indeed.
Councillor Huckstep, I wonder if I might just make one further comment. I do apologise, but I'd be grateful if I could. Thank you. So members, it may surprise you or maybe it won't, but the 23rd of March represents the 1-year anniversary of the first lockdown being imposed. So we are on the cusp of 12 months of living under restrictions of various kinds. I did just want to add, if I could, that on the 23rd of March, Hampshire County Council will be working with Hampshire Care Association to mark that 1 year anniversary. And I would just like to add again my thanks to all staff, all colleagues working across the social care sector, not only in care homes, but across all social care support. The compassion, the effort, the humanity that's been displayed over the last 12 months, each and every day, minor miracles, making sure that those people continue to have a quality of life beyond the headlines of what we've been through over the last 12 months is truly phenomenal. And I just wanted to say that publicly, and I would hope that as a committee you would endorse those words and that sentiment. Thank you.
Thank you, Graham. I think you can take it for granted that all the members in this committee will endorse what you have just said. I see no dissent. So that's really good. Thank you very much indeed. So now we can move on to item 10, which is are the proposals to vary services, and they're covered in pages 71 to 86 in your packs, and they're all written reports. They've been provided as written reports to obviously save attendance by NHS personnel. So are there any queries from anyone on any of those three reports?
Chair, at this point, I'm just going to leave the meeting until the end of this item, just because I work through a charity that seeks to influence policy on orthopaedic services, and I've been advised that that counts as a disclosable pecuniary interest, so I'll rejoin at the start of item 11.
That is completely understood, Jonathan. Is there anything, however, that you wanted to say on the two items for which you don't have to stand down?
No, I have no further comments.
Okay, so we'll lock you out of the meeting. Marie, I'm sure you can supervise that.
Yes, that's fine. I'll call him back in when we've moved to the next item.
Excellent. Right, members, any questions on any of the three items in this agenda item? Yes, Councillor Thornton. You're muted, Councillor Thornton.
My apologies, I hadn't lowered my hand. I'm so sorry.
It's a legacy hand, is it? Right.
Yes, I do apologise.
Let's delete the legacy hands. So that leaves Councillor Dowden. No? Yes, Councillor Dowden.
Yeah, sorry, Chairman. Item on the 10A, Chairman. Can I speak on that now? 10A?
Yes, please.
It's obviously it's important that people regain the sort of access they had to primary care before COVID arrived, of course, although not necessarily in the same way. Of course, we're having a greater use of technology, Zoom consultations, etc. I'm sure you've had perhaps some with your surgery, but need to think about people who don't have broadband and IT, because there's still a lot of people within Hampshire that don't have it. So I'm not sure how we're going to deal with that, but it's a real danger. We may see a two-tier system. In other words, I'm all right to be able to get it. You may be all right, but there's other people, particularly in the country, in rural areas, that still haven't got it. How are we going to deal with that?
Yes, I understand the question. We don't have a GP with us at the moment, but you're quite right. Not everybody has broadband or Zoom or whatever, but telephones still apply, and I'm sure potential patients can ring up their GP surgery and explain their particular predicament. Simon or Graham, do you have any knowledge on this area?
I'm sorry, Chairman, it's Graham here. No, I don't, I'm afraid, so I wouldn't be able to offer anything particular.
I think, Councillor Dunn, I think it's a question of reverting to telephone, but if you'd like to email that question, we'll try and get a proper answer from the CCGs. Is that okay?
Yes, Chairman, I was muted. Sorry, yes.
Good. Okay. Any further questions on these items from members? No. So we are accepting the recommendation of noting all these updates. Correct? Thank you. So now we can go to item 11, which is the health and social care system resilience during COVID. So again, this is Director of Adults Health and Care regarding key activities undertaken across the health and social care system to maintain system resilience in the discharge of people from hospital settings during response to COVID-19. So we welcome Graham Allen again as the Director to present. Thank you, Graham.
Sorry, Chair, just before you move on, is Councillor Canty back in? He was out for the last item.
Marie, did you let him in?
I've just invited him to rejoin.
Okay, we'll pause until we know he's here.
Oh, Chair, I've just rejoined.
You've just joined. Thank you, Councillor Canty. Right, go ahead, please, Graham.
Thank you, Chair. Members, good morning. So this is a report that provides an update over the course of the whole of this financial year to date in terms of systems resilience, which is to say the work that we do, particularly with NHS colleagues within acute settings, to speedily and appropriately discharge people from acute hospital settings. A version of this report will be going forward to the Cabinet meeting later this month as well in terms of an update on our performance. So throughout the report, there is reference throughout in terms of the work that we've done collaboratively with NHS partners. And also there is reference in the report to the recently published white paper. And whilst the white paper is relatively light in terms of social care reform, and we hope to receive something further later this year, the white paper, as you've heard already this morning, does provide some future opportunities for greater strategic integration between the NHS and local government, which I think build upon many of the things that we've seen throughout the response to the pandemic. Members, if I can draw your attention firstly to paragraph 6 of the report. Overall, at the time of writing and producing the report, some 6,000 plus people have been supported to leave acute hospital settings through our services. Either return home with additional support, return to a care home setting with additional support, or a temporary admission to a discharge to assess bed-based service. New discharge arrangements have been implemented, and the report provides a detailed overview of these amendments to the previous operating model and the discharge legislation and requirements. These are described in paragraphs 9 to 15. Paragraphs 21 to 34 of the report provides detail of the way in which Hampshire County Council, working with system partners, have enacted these new discharge arrangements. It's important to recognise that delayed transfer of care reporting was suspended at the very end of the 2020-21 financial year. Sorry, the 2019-20. So just as we went into the first set of national lockdown, the usual metric, which is the number of people stuck in an acute hospital bed, which was a responsibility of the local authority, that was suspended as we saw work to surge and create space within acute hospital settings. Paragraph 23 sets out the detail of those 6,000 discharges we've supported. Now, just over 50% of those people are new to social care, so not previous known customers or clients of social care services. And of those, just over 3,000 people, fewer than 2% went directly into a permanent care home setting from hospital. And when one compares that to what we saw previously, and indeed historically, the numbers of people going from an acute hospital bed to a permanent care home setting was probably in the order of 20 to 25%. So frequently those people who could be described at their lowest ebb, who may have been delayed in an acute hospital setting, decompensating over a period of time, going to a permanent care home admission, we've seen that number reduce very, very positively. But it does create a risk for the care home sector. And when compared to the data that I shared earlier in terms of the numbers of deaths that we've seen across the care home sector in Hampshire, there is now a gap in terms of the occupancy in the care home sector as a whole, which does bring a degree of risk and fragility to the wider care home sector in terms of their occupancy. In some care homes, occupancy is below 70%, and typically, and this is a generalised comment, most care home settings remain financially viable at occupancy rates of 85% plus. So there is risk out in the care home sector. Paragraph 25 describes the NHS discharge funding received by Hampshire County Council in support of the new discharge requirements. NHS discharge funding support is usually for a period of up to 6 weeks. This will see approximately £24 million being received by Hampshire County Council in this financial year, not only to cover the costs of existing discharge support, given the new discharge regime brought in by emergency legislation by government in the early spring of last year, but also the provision of new services being provided by Hampshire County Council in response to the pandemic challenge, such as the new discharge to assess bed-based services. Examples of these services and new services are given in paragraph 27 of the report. Local CCG partners have acted speedily and honourably with us in making sure that the use of these new discharge funding arrangements and the commissioning of services have proceeded at pace and extremely smoothly. Paragraph 31 of the report identifies an example of what we've stood up in this year, the Clarence unit. Really positive bed-based discharge to assess facilities. Some 73 beds are located within the Clarence unit, and it's also a designated care setting, which means it can take COVID positive patients direct from hospital who don't need to receive ongoing acute secondary care, but need to be nursed back to health. So the Clarence unit provides that care. And a report on the Clarence unit follows this item on the agenda in terms of the work that we've been undertaking. I also want to draw the committee's attention to paragraph 34 of the report, which describes the transformation we've seen in our own in-house reablement service. It's absolutely been in the front line in terms of supporting people to be discharged from hospital over this year, as it has been over a number of years. But the most important thing to draw out is the volume of its work that is now routinely undertaking to keep people at home rather than needing to be admitted to an acute hospital setting. Members, before we'd completed the transformation within our reablement service, roughly 80% of its activity was to support people being discharged from acute hospital settings. Now more than 60% of its work is to keep people safely at home rather than needing to be conveyed or admitted to an acute hospital setting. And I know members will understand and appreciate that, given the call that we saw in the spring of last year to create as much surge capacity as possible in acute hospital settings in advance of what was anticipated in terms of COVID transmission and the need to have as much space as possible available in acute settings for people with COVID-19. So a huge and really positive piece of work within that transformation of our in-house reablement services. Paragraphs 35 to 38 set out some of the opportunities and some of the challenges as we travel forward. As I've already said, a key risk that we are very much attending to with care home partners and care sector partners is, I think, the inevitable need to see some resetting as we proceed forward in terms of the care sector in Hampshire, given the relatively low occupancy within still the 480 care homes that we've got across Hampshire. It's really important to say that in this year, we've seen, I think, only one care home close. Now, in a normal year, i.e. not a year that's absolutely been about responding to a pandemic. In a normal year, we would expect to see approximately 6 care homes closing. And that's really for usual business decisions. Owners, providers deciding that they are now ready to retire and exit the sector. Inevitably, that might mean that the care home building itself is their pension pot that they will look to sell in terms of their retirement pension fund. And it usually necessitates us as a local authority working with that provider to ensure that we can move residents to other care home establishments. We've seen one closure in this year, and I think that's testimony to what we've seen across the care home sector. Despite, in some cases, very low occupancy, providers in the best interest of their residents have kept going, because disruption through the course of the pandemic could have been extremely detrimental to the well-being of their residents. So I would anticipate, I would expect in the coming year and indeed beyond, us to see some resetting in terms of the care home sector across Hampshire. Members, finally, paragraph 45 sets out the work underway as we continue to respond to COVID and look forward beyond this current financial year. There does continue to be uncertainty nationally and locally on the continuation of discharge funding from the NHS, but investment from NHS partners hopefully will continue, and the new pathways that we've been able to build through our response to COVID-19 will hopefully continue. Despite the future architecture for health and care integration identified in the white paper, integration and innovation working together to improve health and social care for all, we do need to see, hopefully, continuation of that discharge funding. Many of my NHS colleagues at chief executive level would agree with me that it's the thing that's seen the greatest transformational difference through this year, as we've been able to move people speedily and appropriately from acute hospital settings so that they stand a chance of recovery through our discharge to assess provision and then on to their permanent care environment. For most people, that remains their own home, but that up to 6 weeks funding has absolutely provided a really, really important buffer to make sure that collectively across the NHS and social care, we can get that provision right in the best interest of the people that we serve. Thank you, Chairman. I'll pause there.
Thank you, Graham. That's a very comprehensive report for us. I just got one question on paragraph 23, the histogram. I notice it finishes Sunday, the 17th of January. Can we assume that the subsequent bars in time are lower than the one for the 17th of January?
No, so my apologies. It's to do with the lead-in time for reports being submitted for the committee. I can certainly update on discharges since the middle of January onwards by providing a written response. What we have continued to see is a very positive rate of discharge, and indeed in recent weeks we've actually seen a further upsurge in discharge. So rather than the bars beyond the 17th of January going down, they're in fact going up. But I will provide that detail to Marie so it can be circulated to the committee.
Thank you, Graham. Thank you. Any questions? Did I see Councillor Dowden had a question? No. Councillor Carew? No.
Yes, please, Chairman.
Yes, go on.
Graham, you've very ably talked to us about care homes, and I'm pleased to say just to see the results. But one of the issues I have in my patch, as you will be aware, is just before Christmas, one of our day centres was closed, apparently through economic reasons. Now, what happens to those people who require respite? And I say this as a former carer myself, that it can at times be utterly exhausting, and particularly when you're looking after somebody who's got dementia. Do we know, I mean, do we know if what happened in my area is something that's been reflected across Hampshire, or was the situation in Whitehall and Borden a particular issue that is perhaps unique to that area? I do find it, incidentally, very strange that, considering we've got both a young population and an older and getting older population, that there apparently, due to age concern, Hampshire wasn't the demand for it. I do find that strange, but that could have been down to COVID. Would you like to comment, please?
Yeah, thank you, Councillor Carew. I'll just unpack, because I think within your question there are a number of different strands, and they're all really, really key. If I begin with the question with regard to respite. So what we saw in terms of bed-based respite, the national guidance that came from government was that individuals had to self-isolate for an extended period of time before they could be considered for respite provision. And that very requirement meant that respite providers were unable to operate in a safe way in terms of respite. So effectively what we've seen from a whole variety of providers across the county of Hampshire, but indeed nationally across England, is a whole series of alternative approaches in terms of, rather than people coming into respite bed-based facilities, services have gone out to provide safe and appropriate in-reach respite to give carers and others the opportunity for respite, albeit in the individual's own home. And to some degree, that's an extension of domiciliary type care arrangements. And certainly, and Jess Hutchinson made reference to it earlier, in terms of the work that we've been doing in support of family carers, it's been a very significant risk factor that we identified very early on, particularly for younger adults with care needs, living with parents or other family carers. The amount of pressure on those individuals has been absolutely phenomenally significant throughout. And whilst by and large most day opportunities, most day centres, because of national restrictions, have been closed and are currently closed, what I can say is, with regard to, for example, our own in-house day opportunities for younger adults with complex learning and other support needs, we've been operating, albeit at much lower numbers, based on the risk of family breakdown or carer breakdown that would otherwise ensue if those individuals were unable to receive any day opportunity provision at all. So pre-COVID, we would expect to see around about 500 young people with learning disabilities and other complex support needs attending our day opportunities provided by Hampshire County Council. That number now is varying between about 150 and 200 per day. And that's vitally important in terms of giving family carers the kind of break, the kind of respite that they so urgently need. For older people, we have seen by and large day opportunities for older people similarly needing to operate in different ways. So not bringing people in to day centres and day opportunity facilities, again, for reasons that I gave earlier. So if older people may be experiencing dementia or other needs, it's then very difficult to maintain social distancing and therefore limit the risk that would present itself. So working with Age Concern Hampshire and other providers, outreach opportunities, and some of those are through direct support, and some of them are through maintaining contact through telephone, through video conferencing and other mechanisms. So as best we possibly can, working with all of our provider partners, support is ongoing, albeit different in many cases to what people would anticipate and expect. And what I can say is, very positively, we maintain that contact with individuals. The support that I made reference to in my earlier presentation around the care sector support in terms of financial support, infection prevention control, all of those measures and mechanisms extend out to all settings, whether they be care homes or domiciliary or community settings. Thank you.
Thank you, Graham. Councillor Dowden.
Thank you, Graham.
Yes, thank you, Chairman. Graham, I said it at full council and I'll say it again here today. Quite frankly, I congratulate you, the other directors, all the staff in the adult social care, right down to the ordinary carer that's going into the household that's doing a fantastic job. I think you're all to be congratulated, quite frankly. There's one thing that I want to establish, though. I don't know whether there's a timetable for it, because what I would like, and I think the select committee should want to know, is what actually went very well and what went wrong. And because we can learn from mistakes, and if we don't have a sort of an inquest, if you like, we will never learn. And I think it's very important, particularly as well, if there were any, well, we know there's always financial issues, of course, particularly with an adult social care, but what is actually necessary to prepare ourselves well for because these pandemics, it's not going to be a one-off. I hope to God we don't get another one, but clearly we have to be prepared in case there was another one, because these mutants are changing and who knows? Nobody does know. Not even the scientists can tell you definitely there's not going to be another one. So I think we need to be well prepared. And I know it's been a terribly busy time for you, but is there any sort of timetable when this inquest could take place? Because the quicker we learn, the better.
Yeah, thank you, Councillor Dowden. I think just by way of a couple of introductory comments before I respond to your question. The first thing to say is that in terms of the British government's list of risk, pandemic flu has been the top risk for probably the last decade or more, just in terms of needing to be prepared. And despite many of the challenges that we've seen, I think across all public bodies, there's been regular rehearsal and preparation and exercising in terms of what we have needed to do. That's why some elements, certainly not all, but some elements actually in terms of our response have gone as well as they have gone. The second comment I would make is despite all of the positive news that you've heard thus far this morning in terms of where we currently are, and it is extremely positive news in terms of the progress that's being made, both in terms of the reducing incidence of COVID-19 across our communities, the vaccination programme, and so on, we do remain in major incident response. So we are far from out of the woods. So we are still responding, but alongside still responding, we are also, as we're going along, where we need to, clearly learning lessons in terms of the different waves that we've been through thus far. And indeed, in one of my roles as chair of the Hampshire Safeguarding Adults Board, I've commissioned a learning review across all of the organisations that make up the Hampshire Safeguarding Adults Board. So the local authority, the NHS, Blue Light Responder colleagues, so ambulance, fire and rescue, police, voluntary community sector, the wider care sector, colleagues working in district and borough councils in functions such as housing, and so on and so forth. I'm hoping that will be able to report early in April. So certainly following local government elections, I would hope that by the next time this committee convenes, we will be able to provide an update in terms of both lessons learned, but also the things that we think went particularly well, because we need to look at both those elements, I think. Clearly, as we go forward, we will focus on the things that need to be improved upon, but at the same time, I would also want us to be paying due credit to the way in which all organisations, all staff have been able to respond in the magnificent way that they have thus far. But it is absolutely a critical and key issue for us. Thereafter, in terms of a timetable or a timeline, there is then a cycle which will be undertaken through the mechanism of the Local Resilience Forum, so that more broadly lessons learned can be looked at in more detail and become part of future learning and future exercising that we as a collaborative through the Local Resilience Forum do on a regular basis. And I'm absolutely sure that some of the lessons learned will require us through responses to national bodies and also to national government around some of the challenges that we saw in the spring and summer of last year with, for example, access to PPE. Now that was a global issue, but there are undoubtedly, I think, lessons that will need to be learned. Thank you.
Thank you, Graham. Very apt, the question you've asked, Councillor Dowden, but I'm absolutely convinced that we will learn whatever lessons have to be learned, but it won't be anytime soon necessarily. Graham has quite rightly indicated that obviously as situations arise in real time where clearly something has to be done, it's clearly being done, and that's the main thing. We're still in a battle. Right, I have no further questions on this. We need to go to the recommendations, and we need to look properly at it's page 87 in your pack. The first one is we're being asked to support the continuation of discharge pathways and funding arrangements to maintain and build on progress and performance described in this report and in line with the white paper, integration and innovation, working together to improve health and social care for all, published on the 11th of February this year. Are we members happy to support that recommendation?
Agreed.
Agreed.
Thank you. And the second half of the recommendations were to note the 4 other items, the update report on health and social care resilience, the overall performance, the efforts of staff and partner organisations in maintaining safe, appropriate and resilient discharge pathways within the new national operating framework, and fundamentally changed nature of health and care sector as a consequence of its response to COVID. And obviously that set of noting is clearly indicative of the huge amount of work that people have been doing on our behalf in fighting this COVID pandemic. So, are we agreed to note those updates?
Agreed.
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 Thank you very much indeed. So now we can go to item 11, which again is another starring presentation by Graham. You are working hard today. This is the health and social care system. It's the Clarence Unit, Woodcote Lodge, to report on the arrangements for that. So, Graham, would you like to give us your presentation on this? This report starts on page 103 of your packs.
So thank you, Chairman, but I'm sorry to disappoint. I'm hoping that my colleague Paul Archer has joined us in order to present on this item. Can I just check if Paul is here?
I am, Graham. Yep.
So if I can hand over to Paul, Chairman, I'd be very grateful, who'll take you through the detail in this report.
Welcome, Paul. I hadn't realised you were going to be doing this, but that's absolutely fine.
Okay, thank you very much, Chairman, and good afternoon, everybody. This is a report, as you outlined, on the Clarence units, which is in Gosport, serving South East Hampshire patients, largely from Queen Alexandra Hospital. As indicated in the early paragraphs of the report, paragraphs 1 and 2, this discharge to assess units was established at speed last year. We established it around June, mainly at that time as a response to the COVID challenges and trying to keep the hospital as clear as we possibly could, timely discharges and the like, but very much with an eye on this was a potential opportunity to start developing future state infrastructure. And by that, I mean infrastructure and services which were going to serve us in a sustained way beyond the COVID pandemic. And we've still got very much one eye on trying to make sure that that happens. Not just, I hasten to add, for the southeast of the county, although obviously it's a very important and very busy area, but also to look at opportunities for some repurposing of HCC care facilities in other locations in order that we can have a consistent discharge to assess service offer for very vulnerable patients who leave hospital under pathway 3. These are complex, frail, elderly patients, very often whom would then go on to a long-term residential and or nursing care setting without the ability to, recover sufficiently to lead some form of independent life back in their homes. So discharge to assess, by its very nature, means that the assessment is done outside of the hospital. The discharge is done in a really timely fashion. We're talking in 24 to 48 hours from the point that individuals become medically fit, rather than can be a week, 2 weeks, or even longer for that determination and then their onward care to be organised from within the hospital. And what we've also done with the D2A offering at Clarence, and we absolutely predicated the implementation of it on this, was to ensure that it had very strong therapy input built into the day-to-day care that was on offer for the vulnerable patients that left QA and went there. And as says in paragraph 3 of the report, what we've seen is some remarkable performance elements and some remarkably strong outcomes for people. We've seen length of stay in the Clarence unit typically being in the order of 25 days, although sometimes those that need to stay there longer can bring that average up, and probably 70 or 80% of the people are actually going through there in 21 days. We've seen less than 25% of those that leave Clarence needing to go on to a long-term residential or nursing care setting. And we've seen around about 60% when we were operating normally up to Christmas, able, after their recovery period and therapy support period in Clarence, actually able to return home. In some cases, returning home with no onward care support, didn't need it. In the vast majority of cases, some form of domiciliary care or other support still being provided, but being provided in the person's home where their levels of independence and the place that they want to be is absolutely coming to the fore. Paragraph 4 just makes a reference to the challenges for the system and for all of us in a success story in 2021 that in the short term has been funded via the government's discharge funding arrangements and their scheme financial support. How do we turn that into something which becomes a permanent piece of the infrastructure in the southeast? We look to repurpose existing business as usual monies towards what really ought to be a significant priority for the system going forward, so that we can maintain such great outcomes for people and maintain such great performance levels, but doing it largely or wholly, as it's looking like, from resources that sit within the NHS and the county council as we come out of the pandemic and the short-term funding arrangements drop away. I don't intend to go through the report in loads of detail. I think I've covered the salient points. The way the report's been written is to provide some contextual information, particularly around the southeast system, which starts at paragraph 13. Then a little bit further on, what we've got from 17 onwards is a whole load of commentary around the chronological build up of the way that the service was developed through from June to Christmas and onwards, with steady successes being developed over that time, as first of all we developed one floor, then a second floor, and then added in the third. The report also references the benefits of Clarence right at the peak wave of COVID just before Christmas, in the sense that we were able to designate and have that designation signed off by CQC, the ability effectively to put one floor as a designated setting, which was then able to take COVID positive individuals that were fit to leave hospital, but nevertheless carried the virus. And we were able to transition and discharge still in the same timeframes into a very safe environment, operating to the absolute optimal infection control standards, which served us all well and meant that we could maintain flow out of the hospital at what was a really critically important and challenging time for everybody. The section after the operation for 2021 just briefly introduces some of the opportunities and the challenges that we've got ahead. So this is section 26 onwards. And what we outline there is that we're in discussion with the landlord in terms of trying to extend the lease arrangements. And those discussions are going very positively. That the South East executives are looking at the repurposing of funding. And I'm pleased to say that as things stand, we're due to take reports to the South East executives on the 15th of March and to the executive member for health and social care on the 16th of March to secure the Clarence unit for one further year for 21-22, which will be good for all concerned, and then to use the coming months up to the summer to try and secure the financial situation on a longer term basis, so that this can then become very much part of the furniture, part of the permanent infrastructure, and, you know, a really positive service operation for all concerned. I'll leave it there, but I'm very, very happy to take detail on any of the particular elements that are in the report or answer broader questions.
Thank you, Paul. That's very good. This is a very good news story and a great service that Hampshire is now providing. So let's hope it can go forward into the future. I've got a question from Councillor Rod Cooper.
Yes, thank you, Mr. Chairman. It's a credit to you, Paul, that this project has been so successful. I think you can all probably guess what I'm going to say next. Up here in the north, are there any plans or any possibility of a similar facility being established to serve the residents of the Northern Powerhouse?
Councillor Cooper, I'm pleased to say yes, there are, and actually we've got some of that infrastructure in place, and we're building on the early successes that we've had. So we took this opportunity down in the southeast to effectively put back into play a mothballed nursing home that was sat empty and sat vacant and was very opportune. And it was clearly the right thing to do because it added more infrastructure in, and it gave us exactly what we needed when we needed it, and also set us off on the direction of travel and the path that I outlined that will serve us well for the future. What we then did, once we bedded this down over the summer, was we started to repurpose big proportions of 2 HCC care sites, one Forest Court, which serves largely speaking south and southwest, and one at Willow Court in Andover, which largely serves the north and mid-Hants arena. We've added to those with repurposing some beds for north and mid-Hants at Westholme. So now we've got somewhere in the order of 40 to 50 beds spread across a couple of our sites, our own sites. And we've also added in December some surge infrastructure in the independent sector to make sure that we've got sufficient quantities of beds. When things settle back to what I hope will be the new norm, Willow Court and Westholme will continue to serve and meet the needs of North and Mid-Hants, but on a basis and a level that's greater than current, subject of course to what my boss is about to say. So Graham.
Yeah, thank you. I think it's a really germane question, and to some degree the earlier update in terms of the CCG merger and the ICS development in line with the published white paper. When we look towards the Frimley ICS system, and of course, Councillor Cooper, you're talking about the area that's part of the Frimley ICS. We're working currently with different CCG commissioning colleagues. So when Paul is making reference to the Clarence unit at Woodcott, and indeed the South and Southwest and North and Mid, we're also having active conversations with colleagues within the North East Hampshire and Farnham CCG as it currently is with regard to provision for North East Hampshire. We will continue those conversations. We're also hoping that through continued conversations around the next development around the ICSs, Frimley and Hampshire and Isle of Wight, we can arrive at singular commissioning arrangements with colleagues across the county of Hampshire. It is one of the slight tensions at the moment, but we are working through it. Operationally and tactically, there is a huge amount of really positive work. It's at that broader strategic commissioning of resources across the whole county, where currently the NHS arrangements and local government arrangements don't exactly sit together. So it does go to multiple conversations around the same kinds of outcomes and opportunities, but we are making positive progress.
Thank you, Graham. I don't have any further questions, so we can go to the recommendations, and they are profound. That the Health and Adult Social Care Select Committee note the significant system benefits of vastly improved patient flow and reduced discharge delays, that's bed days lost, as a direct result of the discharge to assess service at Clarence unit. And then that the Health and Adult Social Care Select Committee note the positive outcomes being achieved for vulnerable older adults by HCC care at the Clarence unit following discharge from Portsmouth Hospital's NHS Trust, and that the HASC also note the opportunities and challenges of sustaining the Clarence unit discharge to assess service for the medium to long term. Are we agreed those recommendations?
Agreed.
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 It's clearly a successful project, and we wish it well. And thank you, Graham and Paul, for presenting it to us this afternoon. Right, we can now go to the last item on our agenda, which is the work programme. They're on pages 113 to 126 in your packs. Are there any questions or amendments or anything from members? No. So can we agree the work programme?
Agreed.
Agreed. Good.
Agreed.
Agreed. Now the last item I have to say is, before I close the meeting, I should announce that this is my last meeting as chairman and member of the HASC. So I thank you all and all past members for your valuable contributions to our work. I also thank the vice chairman for his support and that of member services over my time, namely Marie Manville, Sumaya Hassan and Katie Benton. Our work is impossible without the cooperation of the executive members for adult social care and public health, respectively Councillors Liz Fairhurst and Judith Grajewski, and before her, Councillor Patricia Stallard, and not least their respective directors, Graham Allen and Simon Bryant, and all the officers of their respective directorates. We are also here, most importantly, to hold the NHS to overview and scrutinise their services on behalf of the residents of Hampshire and increasingly the Isle of Wight. So I also thank sincerely all the NHS personnel who help us with our work and wish them well in the ongoing combat with COVID and its consequences. I'll see some of you finally on the 8th of March for the second meeting of the joint HOSC for the Hampshire Together project for the new critical care hospital. So, best wishes to you all and farewell. Councillor Keast, I believe potentially this is also your last meeting. Do you wish to say anything?
To be fair, Chair, any of us might be our last meeting involuntarily.
Chairman, can I just say something, Chairman?
Yes, please.
I'd like to thank you, Chairman, as a chairman. I think you've been pretty fair, actually. And you've also chaired the meetings very well indeed, and I congratulate you on that. I also wasn't mentioned, but I believe all the opposition members on the House have the one purpose in mind, is to try and make sure that the health services generally are held to account, whatever the service is, and I believe the opposition have played their part in that as well, Chairman.
That is quite right, Councillor Dowden. It's absolutely right. Councillor Carpenter.
Thank you. Yeah, Roger, I wanted to say, and I know that we've had a long meeting today, but I felt it's really important to say that these are how I think of you as chairman. You've been really reliable, thoughtful, eloquent, diligent, a really diligent chairman of this committee, and you always think very carefully about what you're going to say. You've got a huge amount of knowledge, and you've put an incredible amount of time to get to know your brief, and I think that is highly commendable, and I should think that everyone on this committee agrees.
Thank you, Fran. That's very kind. I think Councillor Frankham wishes to speak.
Yes, I'd like to echo everything that's been said by everybody so far. You've been an excellent chair. It's been a great privilege for me to be a county councillor for 20 years, 8 of them on my own as the sole Labour representative. And I've been met with such kindness. I am standing down very reluctantly. However, I just want to say thank you, everybody. And I'm sorry, I'm getting quite emotional now. Bye.
Well done, Jane. You were paid a lot of compliments during the full council meeting we have, and they're echoed again here today. Thank you very much indeed for your contributions to this particular committee. Councillor Craig.
Roger, I just wanted to thank you as chair and for your time of being very patient with us all. You've been a great mentor, and I do appreciate that when I've sent you emails, some of them very soon before meetings, that you've been absolutely brilliant in coming back and replying to them. I think you'll be greatly missed, but it was just to say that these meetings are definitely for the good of the health service. There hasn't been politics involved in these, and we've all worked very, very well. I'm sure that's under your chairmanship. You've been absolutely brilliant. So thank you very much.
Thank you, Tonio, for those kind words. Councillor Carew. You're muted, Councillor Carew.
Chairman, can I just say I've just got to leave now because I've got to prepare for the pension fund plan, Chairman.
Indeed. Thank you for your contributions, Councillor Dowden.
Thank you, Chairman.
Thank you, Chairman. I was just going to say that I think you took over from a very able chairman in former Councillor Pat West, and you have done brilliantly. You have been scrupulously fair and polite and well read and researched throughout, and I think that I couldn't speak more highly of you as a chairman. So I'm very sorry that you'll be standing down, but there you go. All the very best to you.
Thank you, Adam, for those kind words. Councillor Grajewski.
Yes, thank you, Chairman. I just wanted to add my thanks to what everybody else has said this morning. Of course, apart from being a very polite, knowledgeable and gracious chairman of this committee. You work incredibly hard, supporting and challenging myself and Councillor Fairhurst at our decision days. So I will very much miss you as a colleague. Thank you.
Thank you, Judith. I think it really is now time to draw a close. So thank you all for your kind words, and best of luck for the future for you all, whichever direction it takes you. Farewell.
Thank you, Roger.